इसके बाद अगर तुम्हें
हो गया 10:30
10:30 नहीं 15 से कर दिया था 15 हाँ चलो हाँ
पोडियम जैसा लग रहा है।
इधर आ जाओ
लाइव हो बड़ी चीज़ बताओ, यहाँ पे 3 चेयर्स हैं, किसी को वहाँ तक पहुँचना है स्टूडेंट्स होगा ना, कोई पक्का इसमें टाइम मारेगा।
मैं तो इधर से इधर आ
पैर ना लग जाए किसी को।
इधर कोई नहीं बैठे ना, इधर तक बैठे हैं
इस साइड
बंदे नहीं दिखे
थोड़ा और आगे
तो यहाँ पे कलर यहाँ से
now we have area to walk around. उसके चार्जर उसको थोड़ा सा और तेरे को कैमरा में ऐसे करना है तेरे रिपोर्ट नहीं इसका ये
Hi everyone, we'll be commencing in 5 minutes. Hi everyone, our panelist and the chief guest will be joining us in a while, then we'll be starting.
sincere apologies to some of the speakers, the panelists, and the chief guest is also here in the premise only. But they'll be reaching in any time. So very sorry for this. Thank you very much for your patience.
मुझे नहीं पता, मैंने देख लिया, मैंने सेट से किया था यहाँ पे देखो।
Hi everyone. Thank you so much for the patience. Apologies for the delay. We'll be starting now. My name is Vishaka, and on behalf of DevInsights, I would like to extend a heartfelt thanks to all of you for joining us today at the launch of our latest CSR report, Beyond Profits, Trends and the Untapped Potential of CSR in India, Healthcare Edition. We are thrilled to have each one of you here with us today. DevInsights is a leading provider of research, monitoring, evaluation, and learning services dedicated to empowering organizations in the social development sector to make informed decisions through data-driven insights. Established in 2015, DevInsights has worked across South Asia and 26 Indian states, collaborating with NGOs, trusts, foundations, and policy-making bodies worldwide. Our team specializes in designing and implementing comprehensive MEL frameworks, conducting social research, and delivering impactful evaluations that drive positive social change. Through evidence-based analysis and strategic advisory, we aim to strengthen organizational capacity, foster learning, and enhance the effectiveness of programs and policies. At DevInsights, we believe that robust data and strategic insights are key to addressing complex social challenges and achieving sustainable development goals. Today's event is particularly special as we launch our latest report, which explores the untapped potential of CSR in transforming the healthcare sector in India. This report is not just a collection of data, it represents our collective vision for a healthier, more equitable India. And it calls upon all of us to leverage the CSR for meaningful social change. To officially kick off today's event, I would like to call upon Mr. Paresh Kumar, CEO and co-founder of DevInsights. Mr. Paresh has been a visionary leader in driving data-driven insights for social impact, and under his guidance, DevInsights has grown to become a significant force in the field of social development sector. Please join me in welcoming Mr. Paresh Kumar to the stage.
Good morning, everyone. Thank you very much for being here today. And a warm namaste to all of you. I'm genuinely very grateful, very honored, obliged, all of you, that you could take out time of your very busy schedule to be a part of this significant event. It's not really often that we have the opportunity to have a gathering of such diverse and distinguished group of individuals that has a common purpose, which is our commitment to the society and our collective responsibility to bring about the change. We all have different roles and responsibilities that we play, but what binds us together, what unites us, is our dedication towards making a difference, either by ways of corporate initiatives, by ways of conducting academic research, by ways of policy formulation, or by ways of carrying out on-ground initiatives. We all contribute to the change of the society in our own unique ways. So, ladies and gentlemen, today we are here to launch this CSR report, which delves into the CSR stance on the healthcare sector in India, which is being presented in a very unique way. And launching this report in the presence of such an esteemed, this august audience is indeed an honor. The report, Beyond Profit, Spends and Untapped Potential of CSR in India, the Healthcare Edition, is the first of its series. We'll be launching the other editions. The next edition will be Education, followed by the Climate Change Edition. Is a culmination of months of research, analysis, and collaboration. A dedicated team of researchers, analysts, editors, designers, they came together to bring out this report, and I'm very happy to have all the researchers, the analysts, in this hall. I'm very happy to name them: Sabya, Krish, Asmita, Sagar, Veera, Devrat, they all have worked tremendously hard to bring about this very useful report, which is going to be launched very soon. Some of you have already gone through it already. Nonetheless, I just wanted to remind you that we, at DevInsights, take the role of knowledge-based organization very seriously. When we started working on this report, our aim was very clear, and we wanted to bring out a report that uncovers some of the interesting tenets of CSR data. So we had access to data, wealth of data from different sources, but the challenge was that the data is generally overwhelming. All of you would agree to this. So it was very important for us to make all those humongous data sense. So you have data, a lot of information to look into it and make sense of it. So therefore, we understand that data is crucial, but it has to make sense also. And therefore, our team of researchers and analysts, they decided to bring out a meaning of it. So to write a report which is easy to understand, easy to decipher, and make sense out of it. So this report doesn't just contain data. It contains a lot of inferences also based on the data. So the team used very simple analysis and incorporated a lot of visualization to make it very reader friendly, and which should help all of us in our own ways, in our roles, to help in data-driven decision making. So I believe that this report is going to be a go-to document, to understand anything about the CSR expenditure investments in the healthcare sector. And this doesn't just contain the past trends, but when you read the report, it also provides a roadmap for the future to some extent in the healthcare sector particularly. And the healthcare sector, as we all understand, that it is at the heart of the global social development. And it is where the impact of any CSR intervention in the healthcare sector will be most profoundly felt. And therefore, channelizing, mobilizing CSR mandates into the healthcare sector is really, really important. With this, I would like to share that in the coming moments, we have our distinguished guest with us, Mr. Mangla, who will be talking about, sharing his insights on how CSR can be used to contribute into the overall health landscape of the nation. And then, followed by, there are two panel discussion sessions, which I promise that's going to be extremely engaging, enlightening, and thought-provoking. The panel discussion sessions are moderated by Professor Dr. Bulbul Sood and Mr. Prasanna Tatte. The expert panelists, speakers in those panels are going to talk about the opportunities and challenges that we see in the healthcare sector from the CSR perspective. And also, the second panel would majorly delve into understanding the importance of measuring impact of the social development, social development interventions, particularly CSR interventions. So, ladies and gentlemen, without further ado, I would like to start the process formally by with the launch of the report by our distinguished Mr. Mangla. I think He'll be coming here very soon. You know, unfortunately, there is another event, similar kind of event happening in the same premise in another hall, and so he should be here any moment. But you know, we thought we'd just start it. So maybe if he comes in, maybe we can just start with the launch of the report. And so thank you once again for you know, coming here. And as we engage into the discussions, my thought, my hope is that whatever tiny decisions we make today, whatever strategic decisions we take today, should contribute into the overall health landscape of the nation, should be able to improve the health of the communities, and we should move forward towards making India a Vikasit Bharat. Thank you very much once again, ladies and gentlemen.
Thank you so much, sir, for your insightful remarks and for setting the stage for today's discussions. Your words have truly highlighted the importance of CSR in healthcare. Next, before we move on to the next part of our event, the official release of the report, I would like to call upon Ms. Asmita Yadav, our Deputy Manager, MLE at DevInsights, to give the overview of the report.
Good morning, everyone. It's a pleasure to be here today and share insights from our latest reports, Beyond Profits, Trends and the Untapped Potential of Corporate Social Responsibility in India, with a specific focus on healthcare sector. This report is a culmination of extensive research and analysis driven by our commitment at DevInsights to harness the power of data for social good. At its core, corporate social responsibility reflects the broader principle of the triple bottom line approach. This approach encourages companies to not just focus on profit, but also on their impact on planet and the people. In today's world, CSR has become crucial for businesses moving beyond just following the law, but to actually contributing to the welfare of the community as well as the environment. Our report uncovers several significant trends, such as healthcare CSR spending has shown a consistent increase with 49% surge during the COVID-19 pandemic in the financial year 2020-21. Both public sector undertakings and private sector companies, they have substantially increased their contribution with healthcare, particularly in the healthcare sector, with PSU seeing a 3.32-fold rise and private companies experiencing a 2.7-fold rise from the financial year 2017-18 to financial year 21-22. However, regional disparities exist. While states like Maharashtra, they have received substantial CSR investments. Others, particularly in the Northeast, they are just beginning to receive funding. The report also delves into several key areas, including preventive healthcare, which has emerged as a crucial focus for long-term public health improvement. The report also examines how CSR initiatives are addressing the broader social determinants of health and explores how these efforts align with and support the objectives of National Health Policy 2017. Looking to the future, the report also identifies several areas ripe for CSR investment, which includes palliative care, geriatric care, and emergency care training. To conclude, I would say that this report serves as both a reflection of the progress that has been made so far, and it also provides a roadmap for the future. So this report serves as a valuable resource for policymakers, corporate leaders, researchers, and CSR professionals, as it provides data-driven insights which can guide future CSR activities. So I encourage all of you to consider how the findings from this report can inform your work, and together we can drive forward our collective goal of building a stronger, more resilient healthcare system for India. Thank you.
Thank you so much, Asmita, for providing us with an overview of the report. Your insights have truly set the stage for a deeper understanding of the findings of the report and their broader implications. Now, as we approach the official release of the report, it is my great honor to introduce our distinguished guest for today. He is a 2008 batch Indian Administrative Service Officer from the Jharkhand cadre, recently appointed as the Director in the Department of Health and Family Welfare under the Ministry of Health and Family Welfare, where he oversees critical health initiatives impacting millions across the nation. Prior to his role, he was the Director of Higher Education in Jharkhand, contributing significantly to advancing education in the state. With his extensive background in administration and policy making, he brings valuable insights into the intersection of CSR and healthcare, exploring how these initiatives can complement government efforts to improve public health. We are privileged to have him here to share his thoughts. Please join me in welcoming Mr. Harsh Mangla.
We are very glad, very happy to announce that we have Dr. Saroj with us, who is director with the NHM. Dr. Saroj, kindly come to the stage. Thank you very much for coming, sir.
Ladies and gentlemen, we now come to the moment we all have been eagerly waiting for, the unveiling of the report. Ladies and gentlemen, beyond profit, strength and the untapped potential of CSR in India. Please have a big round of applause as we officially launch this. I would like to ask Mr. Harsh Mangla to share his thoughts on the report and the healthcare sector in India.
Good morning all. I am looking after national health missions in January 2022 in this ministry, and previously as has been told, I was in the state of Jharkhand because that is my career. Today I am feeling happy also by joining this event because everybody knows the significance of health and also the significance of all the partners who can join in health movement as such, because every penny spent in health or education also gives multiple times of return. I also incidentally recall when I was DM in Godda in Jharkhand. So there I was associated with one of the projects of Coal India Limited. It was funded by CSR, and the local member of parliament was very eager to get it sanctioned, and one hospital was planned with the funds of CIL. So as a DM we are associated with the CSR funds and spending. Probably right now also the DMs are the chairperson of the committee to decide what work has to be taken from the CSR. So this activity is very important, as everybody knows, and I'm fortunate that I'm part of this event today. While I was watching some of the figures, I have not read it in detail, but I have seen that it is also mentioned in the graph here that overall this spending is increasing, and overall almost on an average 5,000 odd crores figure is being reported in this report. We also finalize the national health accounts of ministry, and also state also finalizing their state health accounts. So we roughly see that almost more than 3 lakh crores per annum is the government current health expenditure. So it comes roughly around maybe 1% or so. I think it is a good figure, but there are few things which are, if I hope that some PSU representatives or the corporate representatives who are the actually partner in this CSR. So maybe we have certain priorities from the ministry. We have seen that the spending were done more of the tertiary side and for the setup of the health facilities that are also required in the country like India, but in India more requirement is on the primary and secondary healthcare side. So that gives more impetus to the health sector and also the benefits access to the people. So like we are spending much money in this strengthening of the sub-health center and primary health center, and which are the first point of contact for rural people, because we do not imagine, many of us may not, maybe they have seen but may not have seen the rural setup, how they are dependent, how much they are dependent on the primary health care, and how much they are dependent upon even the community health officer, which is just the nursing cadre person in healthcare. They are so much relying and dependent on them because they have no other option. So we think that the primary health has more requirement. The national health policy also says that 2/3 of the budget should be spent on the primary health care. So I wish and I think and I want that major spending of CSR must go to primary health care somehow or the other. So if we can somehow move this agenda in our thinking process or in our thinking body, then it will help us. And this is actually evident from the ministry spending also, state spending also, that they are increasing the spending on primary health care. Second thing, that can we think of the spending more on the skilling of the health workforce, and also their soft component, like how much trained they are, because we expect that states are providing training to their health workforce, but training quality is not uniform across the state. Infrastructure is also not uniform across the state. Can we add up to the infrastructure of training? Can we add up to the skilling mechanism for these health workers, because it will multiply the benefit of each year, each batches they can learn something from the training material that way. And we also want to reach these specialist services to the doorstep by teleconsultation or some radiology, something like that. Today also we have launched the e-Sanjeevani portal. You must be aware, since I think 2020 onwards. So almost on daily basis 4 lakh calls are happening. But the quality or the availability of the specialist is a further step in that direction. So can we think of providing some specialist hub to the primary healthcare center, so that the community health officer or the medical officer of primary health center can avail the specialist services as the requirement. And now we are expanding also the teleconsultation services. Today we are demonstrating with the state the e-collab kind of some initiative, where the X-ray imaging or these things can be shared to the experts, and they can give their input or opinion on those images. So somehow we are moving into the things that how primary healthcare things can be improvised. Right now I am coming from the World Patient Safety Day celebration by Ministry of Health. There it was being discussed that how we can improve the quality certification of the health facilities. Because unless we have the quality certified health providers, quality certified services, the establishment of health facilities doesn't have any meaning. So these things can be one agenda that where the funding can be spent. I'm sure that after reading this report, maybe some more insight I will get, and probably we can also share some of the learnings with the states. We can share some of the ideas of this report with the states. I have seen from this state, I don't know, I'm just raising this issue. It is not something which is a complaint, but I have seen whatever report has been compiled, few states have got the benefit of this funding. So maybe can we think of the more deserving states should get the funding more. We have some poor performing states. So if better performing states will get the more funding, then poor performing states will always be ignored that way. So this should be uniformly or universally applied by all the contributors of this fund. It is not something which is like a complaint. I'm saying this should be a thought-provoking area from my side. I'm saying. So all these things together, this is a good initiative. I thought that I should come and speak something on this topic. And one more thing I want to add, that many programs we are running, emergency thing is something which is lacking much in the primary healthcare centers. There is less focus and less, because they are less trained, they are less equipped for that. So that aspect can be taken. And recently, last year, we have launched a sickle cell mission, where we are screening almost 7 crore people in the tribal dominated 17 states. I attended the CSR conference also. It was organized by BP a few months back. So sickle cell was one of the agenda taken up by them. So we told the people that sickle cell screening center of excellence, where corneal sampling for the fetus, all those things, screening, and there post BMT can be also one option for them. So all these subjects are there for sickle cell mission, which is very important for the nation, and we have an ambitious target of eliminating this after 2047. So I think this is just my contribution right now, and as many people from the corporates are there, so hopefully we can engage more, and more proactive things can come up which are in line of the vision of the ministry. That's it. Thank you. And thank you for the organizers for inviting me and giving this opportunity. Thank you.
Thank you so much, sir, for your inspiring words and for emphasizing the crucial role of CSR healthcare in India. With the report now officially launched, we will move on to the most anticipated segments of today's event, our panel discussion on the future of CSR in healthcare, challenges and opportunities. It is my pleasure to introduce the moderator for our first panel discussion. She is a distinguished public health professional of international repute with over 45 years of experience, of which 23 years were spent in the community medicine department of leading Harding Medical College, Delhi. She holds an MBBS and an MPH and is a member of the National Academy of Medical Sciences, and is also currently working in an advisory role with PSI India, the William J. Clinton Foundation and Ferring Pharma. She has worked as Japanese India country director since 2009, where she made significant contributions to public health, particularly in family planning, maternal, newborn and adolescent health, women cancers and comprehensive primary health care. She has also worked extensively with the Government of India at the national and state levels, international organizations and NGOs to advance safe motherhood and strengthen the nursing and midwifery workforce in the country. Furthermore, she has served as co-chairperson of the White Ribbon Alliance India and tag member of Maternal Task Health Force of Harvard School of Public Health. And she was also a governing board member of the Indian Institute of Health Management and Research in Delhi. Earlier, she has worked as the country director of the Center for Development and Population Activities, overseeing all reproductive, maternal health, women empowerment and adolescent health activities in the country. We are honored to have her with us today. Please join me in welcoming Dr. Bulbul Sood.
Good morning, everyone, and first I would like to thank the organizers for giving me this opportunity to moderate a session with distinguished panelists, and I would like to first introduce my panelists, and I would want them to come on the stage. So first, our distinguished panelist is Dr. Aksa Sheikh. Dr. Akshara Sheikh is a professor of community medicine at Hamdard Institute of Medicine, Medical Sciences and Research, Delhi. Beyond being an academician, she is also a health activist working on inclusion and equity for the transgender community and persons with disability and with mental illnesses. She's one of India's first transgender doctor, and Dr. Sheikh is a respected figure in the field. She's also known for her commitment to public health and her advocacy for the inclusivity and diversity in healthcare. Dr. Sheikh. Our next panelist is Mr. Neeraj Jain. Neeraj, I have known for a long time, is a PARC India's country director since 2016, and since then he's taken part to the next level. He's also, keep it very short, he's also the director of the Growth Operation Asia, Middle East and Europe. So I think he's going to share with us experience not only from India but also from the region. You don't want me to read your...
No, absolutely.
Okay.
We want.
You want?
We want.
People want to hear you.
I'm sure you'll see it someday.
Okay. But he's, of course, he's a strategic thinker, programmer. He knows how to work in partnership and also has been, as I said, a leader in India in one of the very important implementing partners with the government and with other donors. Our next panelist is Dr. Anuradha Jain. I don't know how to introduce her because I have known her for last almost 20 years. And Dr. Anuradha Jain is a senior public health professional with more than 20 years of work experience for health system strengthening, and is currently working in an advisory health role at the USAID. She has worked in diverse settings and roles including Government of India and with international NGO and bilateral funding agencies and healthcare facilities. And I think her biggest asset is how to work with the government at national level and state, and also collaboration. We keep hearing the word collaboration very often, but how to really collaborate in a meaningful way is something which I have learned from Anuradha. So I'm really very happy to have her with us. Our next panelist is Dr. Neerja Arora. Dr. Neerja Arora is a distinguished public health expert with over 34 years of combined clinical and public health experience. She has led significant initiatives for strengthening human resource for health and national programs, especially RMNCHA and National Tuberculosis Eradication Program, with support from WHO, Stop TB Partnership, World Bank, Global Fund, and USAID. She's an alumnus of University College of Medical Sciences, New Delhi, and holds a postgraduate diploma in health and hospital management research. Dr. And last but not least, Mr. Mukesh Kumar Sharma. He is the Executive Director of PSI India, a distinguished professional with over 2 decades of expertise in program management, urban health, reproductive health, and maternal and childhood. And again, he has worked on several programs and organizations like FHI 360 Care International, and he holds, of course, an MBA and a Master's in Social Development. So I am really, honored to be actually with a group of some distinguished people, and as MC said, this hopefully is going to be a very interesting session, question and answer session, where I'm going to ask the panelists few questions, and then we want more interaction with the audience. So before I start, again, as I said, thank you very much, Insight, for inviting me, and also congratulations for coming up with this report, which is very comprehensive, simple to read, easy to understand, and gives a clear direction on what is happening, especially since the time CSR contribution kind of became mandatory in India, because earlier it was more on voluntary basis, and Tata Trust was the first one to start putting money in CSR. But now, since 2014, we find that more and more companies, public sector undertaking and non-public sector undertaking are putting money in the CSR, and the good news is that, I was looking at the report that since 17-18, almost 17,000 crores was spent on CSR, and in the 21-22 it had increased to almost 36,000 crores. So there is increase in the amount of money being spent on the CSR. But good news for the health sector is that almost 40% of the entire spending is on health and water and sanitation. So health is getting a lot of traction from the public sector, from the PSUs for investing in, and I think very nice to see that. I said how we utilize this fund is very important, as Mr. Bangla said. Again, there is a skewed distribution of all this money. You see that maximum money is being spent in Maharashtra and Tamil Nadu, Karnataka, Gujarat, and in fact in Northeast only Assam, I saw that some money is being spent in. So there's a slight increase, but I think we need to also, and I'm going to be asking the panelists, how do we ensure that more funds are allocated to the states which are more in need? Like, for example, if you look at Rajasthan or Madhya Pradesh or Chhattisgarh or Jharkhand, they definitely require more funding. So what are the maybe the challenges within the system or with the CSR that we unlock the more funding for them? The other good news which I, when I was looking at the programs where the money is being spent is on the preventive and promotive activity, which is really needed. And as you heard also the distinguished guests speaking, that we need to increase, on the family health care. And especially, we need to spend the CSR money not on what already the government is doing, but activities which somehow kind of, are slipping through. And the health promotional activities, education about nutrition, about various programs or utilization of the services, is the need of the hour, and it's good to see that the CSR money is being spent on that. So with that, I'm going to now maybe start with our distinguished panelists, and I'll ask first Dr. Sri, that since you have been working, and being an health activist, you have been working with, a lot of groups where you find that these, how CSR initiative money can be used to, ensure that there is an equitable, diverse, and accessible healthcare spending for all, and particularly for the marginalized population. So what do you?
Thanks, Dr. So, first of all, good morning to everyone, and thank you for listening to us on this busy weekday morning. It's a pleasure, and I hope we are able to share certain experiences and able to gain certain experiences and learnings from all of you, and become wiser at the end of it. I am someone who has a background in teaching public health, medicine, etc., but also working in public health research with groups which are unfortunately marginalized, though they shouldn't have been, and mostly the transgender community, persons from LGBTQIA plus community, persons with disability, persons with mental illnesses, and various intersections of further marginalization, because no one is only having a person with disability, but they also may have other intersectionalities which may add to their marginalizations. While we analyze whether it's the expenditure by the government or whether it's the expenditure by the CSR, we see that healthcare is, of course, a substantial pie. When it comes to government expenditure, we know it's roughly 2 to 3% of the GDP and quite insufficient. And thankfully, it is supplemented by the funding which comes from the CSR. And we have seen in the report how, around 30,000 crore rupees almost is being spent and the distribution across the states. I think what is more important to see is where the CSR is not reaching currently and where it should be reaching. So when we were looking at the states, for example, most of the funding was going to the states which already have good healthcare parameters, mostly in the western and southern India, whereas the states in the northern India were not getting much. Or if you go further north to Ladakh and Jammu and Kashmir, or to the northeast, we see the funds drying up there. Of course, these are challenging territories, but then these are the ones where we need to work on. And I think the more we look at the data and the layers of the data, we'll realize that we are mostly plucking low-hanging fruits when it comes to CSR spend. And something which provides instant results. Results in 1 year that you can put in the annual CSR report with good photographs, and something which is more tangible and visible. But I think the overall CSR, as an institution has matured in India, and it's now time to take up more challenging roles by the companies, especially the ones who are spending a lot of money in it. And cater to the populations that have not been touched, especially those populations which don't come in the priority list of the government. We all know that government has a limited budget and they often prioritize. We just saw, that people were speaking about return on investment. If you put 1 rupee in vaccine, then you get so many rupees of investment. We may not have that kind of return of investment probably when you are looking at for example, working with the marginalized groups, let's say palliative care, or providing a dignified end-of-life care to people. You may not see much return on investment there. They are probably not going to be very productive economic citizens later on. But then that is an area where the government is not working, and I think the CSR needs to fill in the gaps over there. Also, when it comes to the policies, we heard that we are aligning our CSR spendings with the National Health Policy, which came in 2017, and it was pre-pandemic area. A lot has changed in the last 7 years. And I think it's important to look beyond the National Health Policy now, and look at the areas which are not being covered by the National Health Policy. Because all governments have their own policy agenda, and we have to see that as businesses we are everyone's friends and we are no one's friends. So we have to see what are those places that have been missed by the NHP, and especially since I would say it's outdated now, being 7 years old and pre-pandemic. Which are those areas that are being missed? Which are those populations that are being missed, and where we can cater? And it's important to look at the subgroups. I'll give you an example. Like when we say persons with disability, the Rights of Persons with Disability Act mentions 21 different types of disabilities. But when a company is spending on disability, we mostly see them spending on people with visual disability, blind people, or people with locomotor disability, providing wheelchair, and so on, assistive devices. But how many times have you seen them working with intellectual disability, or working with neurodivergent children, or children with learning disabilities, or people with chronic mental illnesses, which are all part of disability groups, or rare disorders like neuromuscular disorders and so on, or spending on research rather than the implementation. So we have to really start thinking beyond the basics. When we talk about spending in the primary healthcare, and I totally agree that we need to spend more on, let's say, a primary healthcare where a pap smear is available rather than a tertiary cancer hospital. But then I think primary care itself is a very late stage when it comes to, disease prevention. People come to primary healthcare when they probably already have gotten sick. We need to look at the social determinants of health. And a very important determinant of that is poverty. Malnutrition. Some of you might have seen the recent Gates report, Goalkeepers report, and it talks about malnutrition as still being the global public health problem, with the layer of climate change being added to it. So unfortunately, even in 2024, we have child malnutrition and deaths due to child malnutrition that we cannot speak of officially in the government figures or data. But then these are the political hot potatoes that the government won't touch, but the corporates need to show guts and venture into those territories and especially cater to those communities which are being left out. I'm also an ethicist and I always talk about this, that in everything that you do, look at the ethics. Is there autonomy? Are we asking the communities what do they want? Or are we saying, oh, you need a sewing machine so that you can tailor clothes and become economically productive? You can ask, maybe they want to learn how to drive a car and become a cab driver. We need to engage the communities in every stage and not just in the implementation. We have to ask, are we doing justice in terms of is there a distribution to everyone or are we only looking at certain groups? Like for example, I somehow feel that women in reproductive age group, RCH, thanks to the work done by ma'am, gets a lot of share of the funds. But when it comes to the aging population, we forget about their contribution and their healthcare needs. That is something that we need to venture into. When it comes to tribals, migrants, internal migrants, displaced populations, displaced due to disasters, etc. These are the ones who are left out. And I think more than the number of people reached out, we have to see how many lives have we really changed and how better have we made their lives.
Thank you very much. I think there was lots of food for thought, and especially as you said, the community has to be actively involved. And when we are talking about people with disability or problem, it's not only certain groups, but the ones which we don't talk about. My next question is to Anuradha about, and you've been working extensively with the government and both public sector as well as private sector. So how do you see the for health system strengthening, how we can collaborate and bring these two groups together and then have a better health for millions of people in this country?
Sure. So, I'll just quote a few examples from a past avatar of me. So, Sannyasi he would remember. At Save the Children, we were working at RMNCHA coalition, and I used to lead that coalition. And one of the subset of the coalition was to bring the private sector together. And during that interaction of private sector, the then ASMD, Ms. Anuradha, actually said something which was very important. And that was that if you need to get private sector in, you would have to create least hassle for them to come and collaborate with governments and to work with them. And for that, we need to create a single window mechanism. Since then, I think the single window mechanism was never created. But what has been created is a social stock exchange where people can come and put their money in. This is a completely different kind of piece that I am not equipped to talk about. But there are people who can talk about it. Nonetheless, starting from that point till date, there is no ecosystem that exists which can bring in private sector to invest in the menu of options that we all want to invest in. So, Dr. Aksa has very, categorically and elaborately mentioned 1, 2, 3, 4, 5, 6 areas that we can work on as CSR and as productive partners with each other. But that would happen only if you have a very clear, mandate that comes to them that you need to invest in this. One of the ways in which USA started doing it is by forming an alliance of what was then called the TB Alliance. And there, we had private sector coming in. We categorized the private sector by saying gold member, platinum member, silver member, and you had an option to say, I would support the program for TB by the NCEP, the program that goes on for the country, and you have a policy for that and a strategy for that. So I would invest in X on the strategy, I would do this on the strategy, I would do Y on the strategy. But that's a vertical program which is a very clear strategy, or which somebody can come and say, okay, I come and invest. But when it comes to a health system, that's something which is very, very different from a vertical program that runs. And when you are talking about system, a lot of things, a lot of investment that goes in the system is not optically visible or viable to the companies that want to see it, as Dr. Aksa also said, as a promotional material for them that can come into the report. So for example, if you are investing in getting HR skilled and HR trained and HR employed, at one point of time, what is the outcome that you are going to show? Because the gratification is not instant. The system takes 5, 10, 16 years to evolve. It's a process that's happening, right? So the gratification may come only after 10 years or 15 years. Immediate ones are not there. So the investment that would come into the system is very, very low. That's the first thing that we have learned in collaboration, vertical versus a systems approach for CSR to spend. The second thing that we have learned is that, again, monetary gains or, most of the CSRs that come and support healthcare, even though they don't come with the intention of getting something back for their business, but at the back of the mind, there is something in the business that's there. I won't name the company, but we worked with an eye care company. And towards the end of our collaboration with the company came and asked us at USA, what is that you have done for us in return? Because we have actually fulfilled our KPIs in the state. So neither did our HR get adopted, nor did our equipment get adopted, nor did our spectacles got adopted. What have you done? So we said we have had the government to change the policy. So till now, government did not used to provide refraction spectacles to people who were between 18 to 50 years of age and did not have cataracts, had simple refraction error. But now the policy is changed and government is ready to provide those spectacles. That is a policy change, and that's a sea change that you're seeing in the policy. But that's not what helps them. So the bottom line that I'm trying to tell here is that long-term investments are not something that are very, it's not a romantic proposition for a lot of CSRs as far as health is concerned. If the gratification is not immediate, the investments don't come easily. The last example that I would quote is that we are doing something known as maternity wallets and maternity loans. And this is in an urban area that we are doing, and it is the need of the hour because you want or you don't want the way urban settings are. A lot of private sector work goes on there, and people do reach out to private sector. They take loans for their illnesses and out-of-pocket expenditure. And when we reached out to a lot of CSR to seek support on maternity loans and maternity wallets, we did not have many buyers for it. The reason is very simple. Risk-taking attitude on the CSRs is looking. So these are some things that I would lay out for some, people to think about. Maybe I can respond to further elaborate answers on this as we go forward. But that's the response that I have when it comes to CSR and the problems in the health systems that we face currently as far as CSR spending.
Thank you, Adranya. I think you have brought out very nicely that the investment there has to be in any area, in any field, for a little longer time, and not yearly, because you don't get any impact in such a short time. So one has to plan that something which may be in the first phase in 2 years, in the next few years, and continuity is very important. So my next question now is to Nitya, your experience of working both in the public sector and the public sector and private sector, and what is your thought that we can involve in a way where one is because the public sector and private sector in health, but my question is that also other sectors, for example, education and health are interrelated. Education, health and climate is interrelated. And somehow we tend to, again, work vertically. So what is your thought in using the CSR money in a more integrated way? Thanks. Thank you, Dr. Bulbul. I haven't thought exactly on these lines, but I'll emerge as I speak. So, like you spoke about the PPP thing. In fact, I started my public health career about 20 years back, that was exactly in 2005, 24th March. I was designated as the PPP consultant for WHO for their TB program in Rajasthan. At that time, I didn't know what PPP stood for. I was just hired like that. But as I was trained, I was told that you have to engage the other partners in for the TB program. And every month I had to fill in a spreadsheet, and within that long spreadsheet, every activity that I did and every output that was resulting from that, I had to disaggregate that into 6 categories. I was told to cover 6 categories of healthcare, providers who could come along. So there was an acronym, HGMCPN. So H was for the health department, G was for departments other than health, like railways, CGHS, PSI, jails also. And M was a medical college, C was corporate, P private providers, and N is the NGO. So we know that all these they can come together, but all of them bring different things to the table. They have different capabilities, even if they are working in the field of healthcare. For example, the medical college, a lot of people come there for diagnosis. So if there was a medical college in a district, about 30 to 40% of TB cases in that district would be diagnosed at the medical college itself. So it improved the case notification in that district. But there was DOTS for TB program, that patient had to go to a DOT center and have the medicine. So medical college would not have that capacity. That kind of close care and nurturing care could be provided by an NGO worker on the ground in a village, or it could be provided by a neighborhood private provider. So they had, and everyone would contribute to care of a small proportion, small number of patients, but that was their value addition to the system. So, we know I knew what medical college could do, I knew what NGOs and PPs could do, but I didn't know what corporates could do. So I took a list from the CII in Rajasthan, and I visited all the corporates that were there in Rajasthan, just to understand how they could be engaged. So I learned a lot. This was 2005, prior to the CSR thing. So they would do things because they also, even at that time, there was a global sustainability report, just with pictures or activities, like Dr. Aksa said, they had to put in there. So it was very much, so what we understood at that time, that they were catering basically to the nearby populations, just to mitigate, whatever bad effects the industry was causing, just to allay all that and, lower the tempers of the communities that they were working within. So every few months they would have some sort of felicitation. So some students would be given scholarship, some students would be given, books, notebooks, uniforms, and swing machines also. So that was there, and the best thing that corporate could offer to me was, you can go and conduct a sensitization session in the nearby colony, which is inhabited by our unorganized workers, and you will be helped by the wife of a very senior person in the corporate, and because she does all the development and social work. So that was the situation in 2005. So I was now working in other things, and come to 2015. So I have a long association with USAID and multiple projects I've been part of. So in 2015, there was a launch of a project called Call to Action for a TB-Free India, where the entire PPP was reimagined, I would say. Not only the CSR, but also the PPP. So it was, a lot of money went into it. It was a high profile, high media, high visibility kind of project. And we even took film stars and cricketers to Dharamshala for a TB summit. We flew them in a chartered plane. But we also brought in Amitabh Bachchan, who was the brand ambassador, as a most important He himself had TB, so he was the best TB advocate we could have. And in that context, now sort of a PMU was established to work on the corporate sector engagement. The seed was born there for the reimagined CSR work. So here, the first thing I remember is a picture where Amitabh Bachchan, the ambassador, US ambassador, Mr. Richard, and Mr. Dr. Naresh Trehan from Vedanta, all of them sitting together and signing the first CSR MOU. So that kind of high visibility, and it triggered a chain reaction. And I have lived to see a lot of change actually happening in the TB world. Between 2015 and now it is 2024, almost 10 years, Vedanta recently has started celebrating its 10 years of TB-free Haryana initiative. So a lot of investments were made. There were people who did concerted work day in, day out on corporate sector engagement. It required a lot of effort, a lot of money was put in, and it has sustained through 10 years. Like we said, now we have to think of long-term view. Nothing is going to be built in a few months or a few years' time. So we have to see this world, and like Anuradha mentioned, the corporate TB pledge. So there was a massive outreach to the corporates. Lot of training of corporate staff happened. Lot of people were trained to serve as consultants for the corporates who could tell them how to design their strategies, corporate sector strategies. I think this is what could also be used for the health and the education part. The concept of corporate TB pledge was that you come over, you sign a pledge. You may come at various levels just to say that you're committed to have workplace things. You'll take a nice take care of your own employees if they were to have TB. You will not discriminate against them. Or you could invest some money, or accordingly those 4 grades of corporate TB pledge happen. So I recently asked, I prepared a slide. Recently asked my colleague from Union, the Union, USAID and the Central TB Division were partners to this whole intervention. And so I'm glad to report that more than 400 corporates across India have joined. And collectively, they have poured in their own resources to the tune of 8.1 million USD. And they have collectively screened about more than many lakhs of TB patients, tested more than 50,000 of them, brought to treatment almost 20,000 of TB patients. And many of them have also signed another pledge, which there is this nutrition scheme by the TB program as corporate, and they are donating nutrition regularly to the TB patient. So what I think is, I was also, when I was preparing that presentation, I was looking at some global good practices, some global case studies, some Indian case studies. And I mean, what was happening globally is also happening in India, even better. But the common thread amongst all this was that there was a lot of collaborative planning. The planning with the local governments, what needs to be done here? What exactly needs to be done here? There is so much resource at their disposal. I have visited a hospital in, I think it was Diu, and a big hospital made with money from multiple channels. Let's say even the CSR money actually belongs to the nation. It has to be used judiciously. So wherever the money came from, there was a big hospital, very good infrastructure, very good equipment, including the 16-module gene expert machine that we were very proud of. But the thing that was not there, there were no patients, and there were no staff to man the hospital. So it was very much like our beautiful Taj Mahal. No one lives there. So so that money you have to see, you have the money because Diu, Daman and Vapi close to that place, they are all industrialized. There are a lot of corporates. So let me tell you why corporates do not go in the periphery, because from the very beginning, the mindset to हमें अपने catchment area में ही करना है, because they are going to say thank you to us, nobody is going to thank us for it. So catchment में करना है, एक बार कर दे तो better है, एक building बना दे तो better है, थोड़ा equipment दे दे तो better है, एक गाड़ी mobile van दे दे तो बहुत अच्छा है. We are not to be bothered by running that for a longer time. So the long-term view is not there. So what happens is that, like I said, all the successful case studies were in collaboration. They were in the unreached, underserved areas. They did little things, and they also served the dignity. They made a hospital. They said you pay a small amount, you get state-of-art facilities close to your home, but you pay for it, even if you pay a small amount. So that kind of thing was there, and a long-term view was there, and most of them were multi-million dollar, multi-year engagements, and that is when the impact was felt. So I'll rest here for the next speaker.
Thank you very much, Reza. It really has to explain, that it has to be long-term planning, and creating pathways is easier, but making sure that they are optimally utilized as they were planned to is very, very important. Neeraj, you have had a lot of experience during the COVID-19, especially where you were able to partner both with the public sector and private sector, especially oxygen and the demand was there, and how you sort of, quickly got together everything and made sure that it was there. And with your experience of also working in the region, what are some of the learnings that you would like to share with us, and how we can further strengthen this collaboration between the public and private sector, but also ensure that the funds, the money is used optimally?
Thanks, Guru. I wish I had the answer to that. All the problems of the world would be solved. But yeah, I'll give you some insights from what we've done and what we've done. Thanks a lot for inviting me to this conversation. I always enjoy conversations around CSR and CSR funding because we do access quite a bit of it. I can tell you it's the most difficult pitch that I have to make every time I have to try and get social responsibility money. The point is social responsibility funding is around equity, right? So I think let's keep health equity, since this is a health conversation, let's keep health equity at the center. So that money is all meant to increase equity in terms of quality of health services. The public health system is also meant to do exactly that, right? It's all about equity, how do we do it? And the third interesting and important player, I'd say important because I'm part of that, is the not-for-profits, right? So there is that third angle to equity. So it's very interesting, you've got these three different types of organizations, groups which are working towards health equity. But there's a huge amount of mistrust which exists between all three of them. I don't know if anybody from the government is here, but they don't trust NGOs. And they definitely don't trust private sector, right? Now you talk to the private sector and they don't trust the government at all. And NGOs, they think, are also mostly corrupt. So they're also very, very skeptical about it. When it comes to NGOs, we want the social responsibility money because that's what pays our salaries. We need the government to work with because they give us our permissions. But we are it's a tough time trying to put this together. And I can tell you, I have been, I have done this in the last 10 years so many times. I have gone in for representation to boards and have had questions which have actually made me squirm. How did you even ask this question? It's a very strange question, but I've responded and tried to bring them along. So let's first accept the fact that there is a mistrust. Let's accept the second fact that the agenda or the end goal is the same. It's health equity. So now we've got a tragedy here, right? You've got three types of groups need to work together. There's no trust. How do we do that? And I think that's possibly what we should be focusing on. How do we bring these three groups together? And Nirja, you were sending me back into old memories about Amitabh Bachchan and the TV pledge and all of that. And I'm wondering where it is now. I should check. But yeah, we've done a similar thing where we are looking at sustainable action for climate health. I mean, there's lots of that stuff happening. But how is it actually going to come together? I think that's my biggest challenge. And I'll give you 3 examples before I go there. I think 2 things that all of us need to be obsessed with, and especially the corporates. And I think for me, if I'm able to convince them that scale and sustainability are critical to every rupee that they are paying. So if they are able to believe that, actually believe it. I mean, they may nod their head, but when they actually believe that scale and sustainability are important, I think we've kind of moved the needle. I think for us to be able to convince government that while the private sector, listen, the private sector has an agenda, and I don't think they're ashamed of it. You know, they're very clear. हमें पैसा कमाना है. Anybody think otherwise? The private sector wants to make money, right? And it's not a bad word, absolutely. By the way, development sector, my thing is okay. I would like to have impact, but before that, I want my salary. You know? So I'm also running after the same money in a way. So, and my management also, exactly. So, you know, let's be very upfront and straightforward about it. We are also trying to sort of run our dukaan, as we call it. So private sector is doing the same thing. And the government wants to see impact. So if we are able to put these 3 things together, I think we have. Now I'll give you, also, all CSR funding, while it is mandated, there are 2 riders that we should not fail. The corporate either wants its brand or its top line to grow, okay? Or they want their government relationship to be such that agli baar permission mein koi problem nahi hai. You know, that the government will sort of say, अच्छा ये अच्छे लोग, इसको तंग मत करो, ये थोड़ा सा गंद मचा रहे हैं, चलने दो. Let them, you know, continue with their whatever they're not possibly. So government image or brand, these 2 are always going to be at the center. Do not think anybody is here from the good of their heart. Okay? They are mandated, and these are the 2 things they're looking for. So we should be okay with that, and we should work on that. I'll give you 3 very interesting examples that I've been through. And I'm going to name the organizations because I think they've really shown certain amount of leadership. The first one is Philips. Now Philips came to us, we were setting up these milk banks, human milk banks. So children who can't actually breastfeed, instead of going on to formula, they get breast milk from a donor mother. Philips was very interested, and I'm wondering to myself, why is Philips interested, right? Then I realized that they have a breast pump called Avid. Right? So from their point of view, if people are going to, learn how to express breast milk, it will maybe at some level it will help their business. I said, listen, we're not going to put your brand there, we're not going to do anything around Philips, we're not going to talk about it, etc. But if you still want to give us money, that's fine. They give us funds, we worked with them for a few years, and just to let you know, there are, I don't know, how many milk banks do you think there are in India? Let's take 3 people's guesses, come on, just shout it out. In India, how many milk banks? 10. Bulbul, who is the dawn of this sector, says 10. Anybody else?
1,000.
Well, somewhere between the 2 of you. So the last I checked, there was 700.
How many are functional?
They are all functional, but limited to their facility. The thing is that we, with this money, we created centers of excellence in Lucknow as well as in Mumbai and Sion. And with that grew. And I mean, we are not really doing that work anymore, but I'm just saying that little investment from Philips. It's grown, it's having a huge impact on units, and I think Philips kind of put their foot forward. But they had an agenda. I don't know if they got anything out of that agenda. Another they never asked me about how many sales did we make and all that. Thankfully, they didn't come and.
I was asked.
Yeah. Okay, the second one I want to talk about is Godrej. Very interesting. So they were running these, they have this Machan Marne ka kuch. I forget the name. I know Godrej, I take their money, but I forget their brands. It helps, Morteen, or is it Good Night? Good Night. Yeah, I think Good Night is there. So they have this brand, and they've been doing some work around malaria, Delhi, in some of the states and villages. And they were continuing with that, and I met them and I said, you know what, you are Godrej, you are one of the biggest organizations in the country. Why are you doing this that kind of work? You should be working at the national. We started working with them at the national level a few years ago. It took time to convince them. They provide technical support to the government of India on malaria, dengue, chikungunya now. In UP and Maharashtra, we've got technical support unit in the ministry, which is supporting prediction of dengue and chikungunya outbreaks and malaria outbreaks. And huge amount of work has happened there. So again, great. It's not a lot of money that they give us, but it's really having a lot of impact. And that is why scale, sustainability, because it's part of the government system, and impact. I think those are the two. Finally, GE. So, you know, these integrated public health laboratories that are being set up across the country. We went out looking for money and we talked to a lot of corporates, etc., etc. We met with GE. They said, अच्छा, so you're going to set up these labs. इसमें हमारा नाम लिखा होगा. ये government lab है, हाँ. तो हम क्या करेंगे? अरे कुछ नहीं, you're going to fund it so that we can rush, make this happen. And if there are some amount of money that might need to be sort of plugged in, etc. It took us a long time, but they agreed. We put them into Odisha. They wanted to into Odisha because of their own reasons. We were okay with that. And 8 public health laboratories in Odisha already up running. Another 8 are going to be ready in the next few months. And that's going to have huge impact because this is a district laboratory where all the diagnostics are done. So, just to close, because I know Mukesh is like, you need to shut up, otherwise I'll never get the mic. But just to close quickly, I think it is important to recognize what everybody's agenda is. It is important to be okay with it, right? Accept it, because otherwise it's not going to work. And then work around it, because your end point is the same. So that's actually, for me, it's important. Now, very interesting. I don't know how many of you are from corporates in this room? 5 or 6. This room should be full of corporates. So I'll request the organizers to do another round. I would love to talk to them. But I think that probably is also the change because we're talking to ourselves, the same community. So thank you so much.
Thank you very much, David. I think the next topic could be how to, remove this mistrust between the 3 groups that you talked about. Maybe we can have that as a next topic of.
Do we need to trust people, or can we just work around the mistrust?
Yeah, I don't know how you can work around. And what is in it for me, everybody's going to ask for that. So it should not be taken as a bad word. What do I care? But at the end of the day, it's not I, but what does the community get? Sorry, my end result. So over to you now, Mukesh. You have been working in urban health, for decades, and also, utilizing not just the government, working with the government, but also with the CSR funds. So what has been your, takeaway from that, and how, what were some of the challenges you faced, and how you overcame?
Thank you, Dr. Bulbul. And first, congratulations to the organizers who have that book released. And I could see that very quickly that there are lots of information and data, triangulation of data, and other things are there. And that is definitely going to help all of us to perhaps develop our strategies or influence our organizational level strategies. Second, thanks for inviting us here. India here, and it's very important month for me because I'm with my gurus and coaches and mentors here, and that will be in the month of September when we celebrated Teacher Term Paper September. That will be for me. I can see many of the people like Sujit ji is here, Kaushik, I can see Kaushik. Dr. Anuradha is a very strict teacher by the way, but her strictness always helps us to learn and think more and more for the communities. So thanks for inviting all of us. Before I give some of the pointers and we have to keep 2-3 things in our mind. First is the population type of our country. We call it generally demographic dividend. And good to see the young population here, young persons here. So our country population, more than 60% of the country population is less than 25 years of age. And And on the other hand, we are aiming 2047 as 100 years of our independence to celebrate as a Viksit Bharat. We have to have our focus on this young population and their health, so that we can say perhaps Viksit Swasth Bharat, developed healthy country. So that population has to be kept in mind. Second is urbanization. Urbanization is very rapid, and Dr. Radha is here as urban expert. We have learned so many things from her. And Association says that by 2030, the urban population may cross the 600 million in the country. So we have to have focus more on urban health infrastructure and taking this scenario in mind. And CSR can play a big role on that. Third is the rural population, and I had a chance to work with many organizations like Care International, in Japan, and HH360, UHRC, and then now PSI India. So the rural population is also developing, and their lifestyle is moving towards urban lifestyle. And it's one study which PSI India is doing. We have some data ready. We will publish that very soon. That there are more than 4,000 villages. Population is over 2,000, and their lifestyle is like urban lifestyle, but they are administered as rural administrative units. So there are another area, and population is very big in these 4,000 plus villages who are looking like urban, and their lifestyle is like urban. And third is the disease pattern. Fourth is the disease patterns. Things are changing very quickly in the country. So disease pattern is also changing. So now daily vaccines and other things are in pipeline process, and many of the organizations are working on that. USAID is already supporting that. And TACADA, so many, the organizations are working on that. Neeraj is here, he is very much in that thing. So we have to think about that disease pattern also. Now coming to those by Dr. Bulbul, that what challenges we faced, or what the things we learned from the corporate funding. So recently we received an award, CSR Times Award in Goa, and this was the award for the project we implemented in Lucknow and Kanpur called Swachh Uday, supported by HCA Foundation. So one of the reporters asked me after the award ceremony that what exactly you are doing in sanitation. So I briefed him very quickly in 2-3 minutes, but I found that it's very difficult to give him the real information what sanitation means. Then we started asking ourselves how to narrate this. So you are sitting here. Every morning we are going to the toilet, we are using the toilet and putting the flush. Have you thought ever that what happens after the flush? Is there any impact of the fecal site management on our health? It is, and it's a big impact on our health. Maybe positive, maybe negative. So we also have a project called After the Flush, and we will get result. But we need to understand that why most of the things are linked with the health. Climate change is linked with the health. Family planning is linked with the climate change. We have to understand all these things, and creating these connections, working with the corporate is very, very difficult. Dr. Amada talked about visibility and non-visibility. So most of the corporates are obviously looking for the visible part. If you are creating a health center, it's visible. It can be inaugurated. It can be printed in the paper. It can go to the publication, social media, everywhere. You can make some roads, some nali khanjari call in slums or in villages, and these things are visible. But there are some invisible results through the process strengthening or health system strengthening, and the result may be visible after 5 years, 10 years. So most of the corporates are either not interested on that, or you need to do lots of advocacy for that, so that they can understand that if they invest now, there may be reduction in mortality after 5 years, and you can see that in the data. Reduction in morbidity after 5 years, and you can see that in the data. Contraceptive prevalence can increase, and you can see that in the data. So that visibility angle needs to be brought in the corporate social responsibility funding. There are one more thing, it's good to see the data, and good to see that CSR funding is increasing year by year, and it is to 17,000 crore a year. If you add the EP money there, like Indian Oil Corporation or TAIL or DAIL, it's above than 24,000 a year. But we need to deep dive the data that where this money is going for the development, to support the government in development. And you won't believe me, DevInsights must be doing the data analysis that 80% of this money, almost 80% of this money are going to the 5 states. We need to do the differential planning, and CSR can play a big role on that. If we are able to establish a system that CSRs are the extended arm of government, or extended arm of private big bodies, then we can be able to capture the 100% of the population, last mile population in the country, and help for all can be very successful to all others. The second thing, Neeraj already said that, convincing corporates for long duration funding is really difficult. So primary care, tertiary care, trauma centers, these are very important things, but at the same time, aging population is also very important. Are we thinking about the critical diseases? From where that money will come for the poor population who is living in urban or rural areas? Critical diseases are having three parts. Critical diseases which can be treated immediately but very high cost. Critical diseases which can be treated for the long time, medicines for the long time, care for the long time, but very high cost. And critical diseases which can go throughout the life, so many resources required, so many support required, but very high cost. From where that money will come? So in big country where we have multiple states, multiple union territories with multiple type of population, multiple health behavior, different type of languages, we need to take care of all these things also. And CSR money can play big role not only in primary care but also in taking care of these type of disease patterns in the country. Challenges, market is very competitive. So any of the non-government organization who is working in the country, they have to work with the resources. So we are non-profit making, but resources are required to reach to the communities and help them to get the desired health services. So that resources are competitive. It comes from the CSR for a year, then it has to be renewed, then again a year, then it has to be renewed. This is a big challenge. On the other hand, if you work with the big donors like USAID or PMGA or some other big donors, you have project for 4 years, 5 years, 3 years at least, and you have plan keeping end in mind that after 3 years what is going to be the indicators in terms of both qualitative and quantitative indicators. So that helps a lot to design the program for the communities. For corporates, it's very important that working with maybe the corporate organizations and bodies like Indian and IAC, and there are so many organizations out there who can design a program for the long duration with a good organization in the country to ensure that end in mind is achieved during the project period sanction or action. So yes, challenges are there, achievements are there. For CSR, generally I used to say one word, it's in Hindi or Sanskrit, I have to figure out. We call it, always this is for God. Swadeyam vastu govindam govindam sarvapaya. Whatever is yours, it is going to you. Whatever you are earning, Neeraj actually said that this is the bread and butter. The earning is most important. But we have came with the empty hand, we will go from the world with the empty hand. Whatever will go with us, the morbidity will reduce, the mortality will reduce. The women who are helped with the support of yours and with your resources, that definitely going with us. So it's money or resources which is they are gaining from the community with their help. A small part is going to them. That's why we call it for DMS to government to be person. So let's deal with this and let's help the vast minority population to be healthy, and let's have great, developed, healthy country in 1947. Sorry, 2047.
Thank you very much. I think that's the goal Modi has, how the country is going to look in 2047. So I think before I ask my panelists to have a last word, maybe some of the questions which corporate, I saw some hands, so maybe you can start with the question. Okay. Hitesh, yeah, go ahead. Please introduce yourself and a particular panelist or
Hello everyone. I'm Hitesh Sani and I work with Population Services International. I have been associated with corporate earlier from the private sector, so I could resonate much with what Anuradha-ji and Neeraj-ji just said. What I see in the report is from the CSR health spend in 21-22 for a year is 7,700 crores, and the top 10 funding companies have only contributed 1,400 crores, which is 20% exactly, which goes on to say that 80% of the money is coming from the rest of the India. that's what exactly the challenge is, that it's too fragmented. The CSR money is so fragmented, and most of the organizations also spend in their backyard. And I've come from a private sector organization. We used to, and I used to manage the CSR fund, so I know we used to strengthen something in our backyard only, say a health facility or so. And also with the recent conversations that we are having with some of the private sector organizations, is also that they want to take up 2 PHCs and work there. Exactly what Anuradha you shared about the vertical approach rather than a system strengthening approach. And this is exactly the challenge. So the question is, I think these fragmented investments and the foot in the door strategy, what you just shared, with the investment that they do, whether it is through a business or the relationship with the government. What can we do to channelize all these CSR investments? And I know the corporates are less in the room. Maybe something like capacity building for the CSRs of the corporates or something. I don't know, but what do you think would be the approach from our side in terms of we play a critical role to channelize the CSR funding in the right way, especially speaking of the health. So question to Anuradha ji or Neeraj, anybody?
Yeah, thanks. That's not an easy answer there. We're all trying to do that. But I think the ideal would be if 10 corporates got together and started funding together, right? So that would be our ideal situation. But corporates are more fiercely competitive than you and I are, okay, in the development sector. So they will probably not want to go with another corporate because they want their brand, their name, whatever. I think it's just about educating. We will have to just constantly be educating. I think what I did today was I talked about 3 examples. Hopefully, if there were other corporates, they would say, hey, I want to be like GE and Philips. I see some corporates here. So if you want to be like GE, Philips, and Godrej, then please call me, or call any of the NGOs in this room. But yeah, I think those examples are important to highlight how they're working towards health systems, how that's helping, what's the impact. That's the only possible way. Another mentioned the social stock exchange. Now that's a start. The writing is still to be sort of deciphered. We'll see how it pans out, but it's a good start. If it works, that could be one of the solutions.
Any other question from the yeah.
So there is a fund for India Tech Fund, right? There are Tata, Gates, and gone. Okay, so they came together. So one of the ways is what Neeraj said, that 10 corporates can come together and decide. The other way that we are trying to work with, again, Neeraj and his team, is an alliance called Such Alliance for Climate, where what we are doing is creating a menu of options for the corporates to invest on. So it's an alliance that gets the private sector and the PSUs on a single platform, understand what climate impact on health is and what health impact on climate is, and then look at the menu of options where they can contribute for a particular amount of time and move on. So it's like handing bacon from one to the other. Because then again, climate is a systemic approach. It can't be fragmented approach. So you can't have one, corporate coming, funding it and moving forward. So you will have a better exchange program. So you finish up to that level, a milestone is achieved, and then you pass it on to the other. So maybe that's one of the approaches you can look at. Having a very clear menu of options, saying this is the strategy, this is the intervention 1, 2, 3, 4. These are the milestones that we have to achieve from here to here. If your interest matches with the milestone, please pick it up, do this piece of work and let the other take on and move on. So that's one way, and this is just us theory right now. It does not happen on the ground, but we are hoping that this may work. The second, way in which is that donors, partners, and government, the consortium comes together. The consortium decides that these are the softer parts that a donor can pick up, where we don't have to have that optics so clearly. We also need optics, but not that the way the corporate needs. These are the pieces as Neeraj brought short in saying that, you know, a breast milk bank is created, or you know, a strategy for dengue or rabies has to be created. Something which is very, very clear in terms of outcomes that you have, because corporate needs outcomes. They have to show outcomes, they cannot work. So they pick up that piece of work, and then the government sector. So it's a tripartite between the three. They decide clearly, they deliver, and then they go. So those are the two ways we are looking at. And recently we have had a meeting as a tripartite with Johnson & Johnson, Lions Club and USA coming together for a piece of work. So that's exactly what we are doing over there. This is what we will do. This is how you piggyback on us and deliver what you want to. And this is the third body which may, through the crowdsourcing, continue that work later. That's the only way.
And I know, I remember there was an alliance with USAID, AOGF and Tata Trust and Reliance Foundation and MSD for Market. They came together for reducing the maternal mortality. So, but clarity has to be there. When you make an alliance, it has to be there, whether it's you want to have a relay kind of a thing or at the same time. And it's important that everybody, all the partners need to be together in the planning and also during the implementation. So I think those are the challenges which have to be also addressed. Any other questions, especially from the corporate our friends who are here in this room? Yeah, please go ahead, introduce yourself.
Yeah, hello, I'm Orko Mukherjee from the CSR of SCI. So thank you for the esteemed panelists, very insightful discussion. So I have a thing, ma'am. So recently, the Ministry of Corporate Affairs, they issued a directive to the CSRs that pulling in interns is as an advisory, that pulling in interns is a thing that CSRs can look out for. So why can't in the health system, like initially sir talked about promoting primary health, ma'am also talked about like disability, the different things of disability, mostly we are in the visual part so why can't we, like US it is there, corporate organizations is there, something promoted not as a mandate part, but as an advisory or a directive part from the Ministry of Health or from the Ministry of Corporate Affairs to the CSR, so that they can also visualize things in that manner, that we can have an impactful program and which is also aligned to the maybe the indicators, like we have the aspirational district indicators or the aspirational block indicators. So in that way, rather than doing a one-time activity. So like something if that as an advisory point of view can come up. So any reflections on that?
Thanks. Any other question or suggestion? Yes.
My name is Dr. Sanjeev. I used to work with several organizations. Currently, I work with it. I have a small question, maybe needless to answer. There are industry bodies, CII, FICCI, PhD Chambers of Commerce, and I did some work with, there is a Center for Excellence for CSR in FICCI, for example, and I did some work with them. Is there a possibility that the industry bodies can spearhead this particular thing, which kind of eliminates or kind of softens the kind of challenges or rough edges which one faces in terms of how do we actually take things forward, either in health or climate and things. I'm just understanding how they could more proactively work to smoothen this work, which can be result-oriented as well as probably process software.
Yeah, absolutely, and it's not like they're not. I was part of setting up something called India Sanitation Coalition about 10, 11 years ago when I was at WaterAid, and that was one body which actually managed to some extent, to bring it together. I wouldn't call it a 100% success, and I'm sure my co-founders would hit me for that. But I think we managed to move the needle, especially when Swachh Bharat was really rolling. There was some amount of, we got corporates in, put them on a platform. CII, I sit at the Public Health Committee there. Again, they are doing that work. But it's very difficult to get two corporates to fund one thing. You should try that out, it's tough. They just don't want to do it, they are fiercely competitive. So, I remember even at the Sanitation Coalition, you either had Unilever fund, funding it, or you had Reckitt funding it. I don't remember one program where Reckitt and Unilever came together, and I know they're going to be very annoyed with what I just said, but it's true. They don't come together. And it's okay, we need to accept it and work on it.
But why is it necessary for them to come together? I mean, like, you can divide, let's say this part is yours and that part is mine.
So we did
your clear outcomes, clear SORIs, clear ROIs.
That's what Radha was talking about.
Don't do just clubbing together.
That
Say,
happens.
this 50% part of the story is yours and that 50% part of the story is mine.
That's what we're doing in the Association of Alliance for Climate Change. So that's how we divide it, and it's working.
Thank you.
Some of them even refuse to do that. So they are working on one brand which is for hand washing and the other brand which is for hand washing. They say it is up to them, we won't talk.
That won't happen. I mean, that's for sure. That if you have two exactly same competitive brands coming together, that's
Unilever to Reckitt.
Complete unlikely.
I used to have to say I think
Yeah, so Unilever stopped talking to me, but that's fine.
It is important to see how the competition can collaboratively work. And which will be the natural.
Yeah, so trying to answer the question that you asked, maybe sharing some thoughts. One thing that we need to understand, and as Neeraj mentioned, that we have 3 partners or players rather in the field, and all of them have the common agenda of health equity. But we need to understand this, that in India we don't have right to health as a constitutional right. Of course, one state government has made the legislation, but we have a derived right to healthcare, and primarily that's the responsibility of the state, whether it's the central government or the state government. The NGOs and the CSR probably contribute to 5 to 10% of our total health expenditure, and therefore we cannot have the burden of catering to everything and everywhere being thrust on the CSR or being on the NGOs, and that's a trap that we often fall into. It's the government's responsibility. But we can, of course, fill into the gaps. We can see what are the underserved areas in populations, what are the new best practices, what are the policy push that we can demonstrate, and those are the areas to focus on. The government does have some social justice mandate, like for example, 4% reservation for persons with disabilities. In some of the states, they have reserved 1% for trans people and all. But, or for example, the SC/ST community and OBC. But when it comes to putting that on the private sector, it becomes a very fiercely contested thing. And I think one thing that we can push for all the private sectors to do is a voluntary disclosure of their diversity and equity. And when I say diversity and equity, it's not only the 2 or 3 areas that they look into, like persons with disability or how many LGBTQI people they have, but also, for example, how many people from the Dalit community are they hiring. No one keeps track of that. Or how many people from Northeast are being hired into the rest of India, or how many women with disability are being hired. So these are the things that the corporates need to do voluntarily. And while Neeraj was giving the examples, of the hidden agenda of some of the companies, I was remembering another example of what pushes companies to invest in certain CSR areas. And in my work with companies working with the queer communities, I found that it's often their own personal experience. Like for example, the Lalit Hotel Group, is investing heavily on LGBTQIA because the son is gay man. Or for example, Marico Industries, Mariwala, because their child is a transgender person. Or you have Tata working with elderly because Mr. J.R.D. Tata himself had an experience of working with a young man and then started teenagers. So we have to also maybe look into these experiences of people when we are pitching, and understand that not everyone will work in disability, not everyone will work, but then identify those who are passionate about something, because as Neeraj mentioned, once their heart moves, then they loosen the purse strings very easily.
Thank you very much. Anyone want to add any last thought?
So I'll resonate what Dr. Akshat has said. And one of the other thing is, it's all about also the genetics of that particular company. So even though genetics are changing these days, there's a lot of mutation happening in genetics of companies. Because the Tata that I know of used to work they never used to ask for outcomes, and some of the best community works that have come in this country have come from Tatas. So they used to donate and then practically forget that they have donated and move on. And some of the best experimentations that's come from Tata Trust. And I think the genetics has changed there also. They have moved on from that particular way of.
Nobody from Tata Trust in the room.
Yeah, they will not, they will go and complain that they are the ambassador there. But what I'm trying to say is that if you look from that standpoint of view, what she's saying, either you're moved personally on things, or there is a way in which the philanthropy has been created in that particular institution that makes it move. So recently, just I lended that example. I was reached out by a very small scale company, and they said that they do not want to donate any money to any NGO or private sector. They want to go for a hospital that's being run by any kind of faith-based organization, because they really want that kind of charity to be donated their money. So it all starts with that kind of mindset, whether personal or general.
I think there's going to be a session on impact assessment later, but I just want to reiterate that nothing is big or small. If 10 companies are contributing only to a small amount, that small contribution being made by small CSRs is most welcome. Probably they are more attached to the ground, probably they are responding to what is really needed on the ground. If a CSR comes up, and I don't want them to build big structures, if they can just contribute, build a broken toilet in a hospital, make a shed for the patients to sit, provide a water cooler, or provide a cooler just to make life easier for the patient, rest houses or dharamshala, I would be happy if they do that, because that's what is really needed. So we have to look at the CSR investment, not again we are citing the big case studies. Let's forget them, let's go and find out case studies from the ground, where the interventions were really relevant to the ground situation, really made in response and consultation with people who said, we want this, give us this. And then also, then the rest can come from the next session. But let these interventions be relevant, and they are most welcome, even in that case. Thank you.
In fact, this is being, this whole panel is being telecast also, and there's a question from Mr. Chen Roy Chaudhary, who has asked, the CSR usually keep working within fixed geography. Is there a mechanism where development targets for these several geographies are part of the CSR annual plan that is validated by local bodies? So maybe you can answer this question.
Yeah, thanks, Chen. And there are some initiatives started by Government of India and some CSR also. There are two parts. We have to think about that. One is if you see the health indicator, the districts and states are identified where more focus need to be given by any CSR or government body. So we have aspirational districts, we have aspirational blocks, we have high priority districts, we have village states. There are many indicators and there are many surveys and data available, and DevInsights is also doing that. Many of them we are transferring platform. So if CSR group or CSR platform is well informed, that to be on time or near real time, that these are the areas need to be worked upon, irrespective of having all money in 5 states, all money in 2 states. So that is going to help all of us, especially CSR money. Government of India has already started through DP. They have started identifying those districts and blocks, and they have started instructing or guiding the government CSR, can say, like Indian Oil Corporation or KDL or KDL and Hindustan Petroleum, to put their money with the help of DMs of that particular district, where they exactly want the money to have the development indicators improve. That has already started in the field, and we have also part of that, and we have also submitted different proposals to many of the districts, and it goes to DMs approve that, then it come back to EP, and EP allot the corporates or DP things so that they can fund that. So all money, resources required for that particular district is designed and developed by the district authorities, and we are a part of that in some of the districts and some of the states. But things have been started, but yes, data and information is very, very important to reach to the corporates on time. So the organizations like DevInsights and there might be a consortium of research agencies who can put all data together and give the government and corporate bodies like corporate affairs and that type of bodies. And they can help them to decide that where money should go. And they can guide their partners or their members to put their money in that particular state and districts.
Thank you very much. And I think what I take learning from this panel, distinguished panel, is that it's important to have a planned way of investing money in whether it's a corporate which is bringing money, whether it's the government money or whether it's a development partner. And a sustainable and scalable model has to be there. And you can't get anything done in a year or so. So have a plan, but you can have a relay race kind of what you were suggesting, or any other different form, but and collaboratively working together, but also looking at how we can, I think that this requires much more deep thinking of the states where still the CSR funding is very low. How do we improve the funding in those states where I think the need is the maximum? Maybe there are some challenges. That's why CSR, corporates are not wanting to put money in those states. So how we can make it ease of doing business, Another talked about, having one window to do everything. Maybe there are certain things which are there, but they have to be implemented. And also bring in, CSR funding, especially for things which are right now missing, whether it's working with geriatric group, whether it's working for palliative care, whether it is working with transgender, whether it's working with other people with disabilities. So I think we need to, really think and really work together to ensure that going forward we would be able to spend, not just increase the money, CSR funding, but also do it in a meaningful way. So thank you very much, everyone, and thank you.
I kindly ask the panelists to sit back for a moment. I would like to ask if we can take a photo with the report.
Whether she should also come.
Thank you so much, everyone. I would like to call upon Ms. Indu Malhotra to present our esteemed guest with a token of appreciation as a gesture of thanks. to our panelists for the enriching discussion and our audience for the thought-provoking questions. I now invite you all for a short break with tea and refreshments. We will reconvene at 1:15 p.m. Thank you so much, everyone.
चार्जर चाहिए यही तो पूछ रहा हूँ कैसे होगा वहाँ लगा के आता हूँ इधर भी है ना रुको मैं अपना वो तो लेके आऊँ यहाँ पे है प्लग
इधर चार्ज पे लगा पेंसिल दो इधर लगा
क्या करूँ जुगाड़ करना होता ओ
नहीं चल रहा है
हो गया भाई
नहीं चल रहा
चल ही नहीं रहा है
लग ही नहीं रहा है मैंने बहुत ट्राई कर लिया
और कहाँ करेगा नहीं इसको स्टेज पर कर तुम लोगों में से कोई भाई अभी देखो स्ट्रीम पॉज हो गया कहाँ डाली है उस पे कोई और कर रहा है ना,
किसका
ये कैमरा मैन वाले का, कैमरे वाले का है। अभी नहीं हुई है वो, बार बार चेंज कर रहे हैं। अरे वो वाला पॉइंट है ना, पोडियम के नीचे तो भी कर सकते हैं। कौन सा है इसमें से मेरे को मिल गया वन।
मुझे पता है पर यहाँ पर साथ थी ना वो काम करने। नहीं लोगों की होंगी। अच्छा हमारे हाँ टेस्ट किया चेंज हो जाएगा 2 मिनट लगेगा तेरे को पता है।
जब भी मैं सोचता हूँ छुट्टी मांगू आपको गायब हो जाती है।
अच्छा चल यहाँ पे 2 रिपोर्ट कम रखा और यहाँ पे 7 ये लाइट चला दो।
I know I used to work during IHF Karna. I used to work with Shankar sir. He's such a gentleman, such a lovely person, you know. Okay, I am. In between his health was not very good. Shireen still in Calcutta? Yes. No, not the GG board. Where is she? Supporting. We are doing a primary impact work in some of the aspirations. If there is a small partner that we can't pay them because we don't have it. If they have their funding and they want to collaborate, we will say the law and ask themselves. The cycle foundation is working in one problem. They have their own institution. They're coming together. So that the impact of what we're doing in primary is support the vendors, people that are involving with primary healthcare. They have to work
मैं बोल देती हूँ कि resuming in 5 minutes. यहीं चल गए तो ऐसा कितना बज
continuing this program forever, despite the commitment of 5 years. So we have been looking at how to engage with the government at every step of the way, right from the directorate level to the primary health center level where we are intervening. We have a set of mobile medical vans which actually go into the healthcare centers. These are fully equipped vans with all the diagnostic facilities which are missing from the healthcare centers. We have these vans equipped with doctors, nurses, pharmacists, technicians, lab technicians, etc. And they go twice to each of these locations to give services to people identified with some of these NCDs. Now, how these people are identified is through our community mobilizers who visit the homes and enlist all the people who are above 30, because typically these diseases are seen in people above the age of 30 years. And there is a form that we are, obviously everybody is using technology, we are also using that. There's a Kobo Collect form in which we take all the parameters which would be looked at to identify these problems, which the community mobilizers can handle. It's in vernacular languages, in Marathi, in Maharashtra, and in Hindi, in Rajasthan. And once these forms are filled and these people are enumerated, then the ANM, our ANMs, the nurses that we have recruited, they go to identify, recheck on these patients and do some vitals there to identify the high-risk patients. And once these high-risk patients are identified, they are then sent into these camps, which are specially done for insulin. Now we have created a funnel like them, and we really believe in impact, because honestly, I heard again previous panelists speaking about why are we, the Tata Trust has been funding without looking at what is the outcome and so on. If that is not going to happen, trust me, a lot of corporates would get rid of their money with Prime Minister Relief Fund, and I'm not sure nobody I think is sure as to what happens with that fund. So if we want some sort of impact to happen from CSR money, it has to, the impact lens has to be looked at, and that's why we are very, very clear right from the beginning in this program that we want to know how many patients did we identify, how many patients were there already having these diseases, but probably they were not adhering to the treatment. Cardiovascular diseases, as per our experience, we have seen that people are still aware of. Pulmonary diseases, very few. Respiratory conditions, very few people are aware of. Most of the people, and we did a study with DevInsights in which, in both these states, and we have realized that majority of the people do not even see the smoke coming from chula as responsible for respiratory health. So, and it's just, maybe probably tobacco or something or the other that is linked. So, that's the kind of, we need to really, and we have done a baseline study, we want to do an endline study, and all through the way we want to monitor our program and understand as to how many people were high risk and how many have continued the treatment, the ones that I identified earlier, the ones that we identified, and these are lifelong diseases, they just don't work. You have to live with them if you don't get treated. So the best that you could do is improve your quality of life. So we have also research components in this project which would assist to do justice to the kind of intervention that's our story of our program. Thank you so much.
Thank you. So in a way, Tushara's answer, I think, was a reply to some of the points, some of the comments made in the first panel. The company does not have a short-term vision. The company does not only operate in its immediate surroundings, but also areas that actually need those interventions. Thanks for that, Tushara. I would now come to Swapnil. Being a seasoned professional in the measurement sector, Swapnil is someone who is probably best suited here to talk about the entire evidence and learning ecosystem that is involved in the CSR sector. And also the mandate for CSR has been only 10 years old. The evidence building and the entire expertise on evidence collection has been there for a very long time, and it's important to know whether CSR sector has benefited from that.
Thanks, Prasanna.
congratulations to DevInsights and Paresh. We are going to share and travel this journey together. So many congratulations to I got this kind of a headline question and this student in a way thought through it and kind of thought through it in two different ways. One is the timeline of CSR. We have spent 10 years and the first 5 years were quite thematic. If you look at somebody's own investment in CSR, we have in a way been very skeptical about our investments in CSR. We have invested in philanthropy and we treat philanthropy differently. We have not never invested in CSR as much as we should have. But things have changed after COVID, I see. And earlier it was much more compliance. In fact, as we speak, it's still much more about compliance than use. But in the last 3-4 years, what I've seen, and this is essentially a meta-analysis of the terms of preferences or opportunities that we see within our organization. So one of the things that catches my attention, and that is a huge labor of hope for us as M&E partners, is the fact that CSR organizations are approaching people like us for creating impact strategies. So impact strategy is the basic backbone of creating M&E for a system. So if you don't understand or appreciate your goals and outcomes, then you will not be able to apply monitoring evaluation. So we start from there. So hand-holding smaller CSR groups in creating their impact strategy is something that I am immensely positive about. One of the things that we still see is that many of the corporate social responsibility organizations are also getting invested in aligning their implementation with their core business strategy. So that also helps them not being kind of ad hoc in investment that they do. So, and then this is still a work in progress. We see many of our opportunities that are coming our way are longer term and a bit more advanced in nature than only sort of periodic impact assessment. So by that I mean monitoring and evaluation has a very strong component of learning. So we somehow forget that part in our engagement. So when you see our earlier work with, say, a Base Foundation or a Rockefeller Foundation, in early days of Samoti, those were the time when we were moving, shifting our sort of base from one-off periodic retrospective evaluations to real-time feedback on creating sort of feedback loops or double learning loops for the implementation to improve. So we have not reached that stage yet. But I see the temperament is moving towards that. People are investing in capacities. One of the things that I'm sort of quite amazed to see is the kind of people who are joining CSR workforce. So we don't see, so mainstream sort of, sorry, I'm not regularly the chartered accountants leading CSR anymore. So you have people who understand CSR, who understand that CSR is a complex process. It cannot be sort of linearly understood. So there are many things to unpack, there are many things to understand before you understand impact properly. So that's the basic for creating an M&E framework. One of the things that from our own experience that we see is role of, and I'm taking you from the previous session, the role of alliance and collaborators. Especially when it comes to smaller CSR, I am personally, I sort of lead a profit-making company. So I am personally quite interested in having as much profits as we can, but responsibly. So I don't see why CSR should invest so much on their learning system. But if they come in collaborative, then it gives them that leeway that we can pull in money and we can create better impact in a shorter duration of time. But as any professional, that becomes more challenging for us to establish that. And moving beyond basic principles of quantitative outcome measurement. So when you're talking about TASRA creating a collaborative on pulling in CSR funds, or ICC creating a collaborative pulling in fund from JSW and many other foundations. So our responsibility is to make sure that individual partners have this confidence that this M&E agency will be able to see out the impact that they have made. And these are fungible sort of mechanisms. It is very difficult to see out. But if you are not completely dependent on compliance, then even qualitative impact articulation works. Yeah.
and that I see. So that also means, personally, you have worked so much on memory. You see that qualitative monitoring evaluation is far more difficult than quantifying results. So I've seen this appetite grow as well. The last point of mine, Prasant, before you shut me down, is around, I take a cue from conversations around equity and talking about marginalized communities. I also see, especially when CSR intentionally pool money in one vehicle or the other, I see focus also gears up towards investing in civil society organizations which engage with the marginalized communities. Yeah. So if you look at how sort of PLASTA secured funding from certain CSR on talking about marginalized population. And these were private sector organizations, and they might not be genetically sensitive, but they see that they have an opportunity, they have a platform where they can also meet their compliance requirements and also create impact in the community. But for us as any organization, we have to evolve in a way that we apply mainstream evaluation science in CSR context. Private sector organization would not have that kind of patience like an academic, to hire an academic institution for impact measurement. We have to be into it. We have to look into human-centered design approaches to be applied in the field to be used in implementation process. Last 30 seconds to me. I talked about first 5 years, second 5 years, and the next 10 years. Again, meta-analysis of the keywords that we get. We see that there are intentional focus on transformative impact. That means our life is different. So are we sort of capable of doing that? I see the investments in OD. So a CSR, because CSR money can be invested in organizational development, can be invested in capacity. So are we as MLE community, are we ready to evaluate that for the CSR folks to get attracted towards that investment? Is a challenge. And we are still grappling with metrics towards it. I'm not saying we don't have metrics. I'm saying metrics which can attract CSR. So that's a challenge. So I'll stop it here.
Thanks, Dr. And thanks for talking about the way the entire sector is evolving in terms of its acceptance of data and more refined techniques of data. I will now turn to Mr. Kaushik, and the question that we had for you was how to really leverage LND to optimize impact in healthcare. Everyone talks about the power of data, but is it really being used, and particularly the entire CSR players themselves, to optimize impact of what their projects are doing? Are they really identifying where the investment is? Are they using data to identify those levers?
Yeah, so we're all looking at data is data is the most important thing, and it's kind of used in all phases of the program cycle, right from planning to seeing if implementation is going right and it's reaching the right people, and are we reaching, is equity being promoted, and all of that. And also in the context of CSR, so data is also important to for the optics side of it, like is the brand being built, are we able to demonstrate social return on investment, all of those things. And it's also kind of important to ensure the sustainability of funding, that's very important. So we are all, we have very good programs where activities are there, leading to outcomes and further impact. And because of the very nature of the short-term nature of the program, so most of the programs tend to focus on the activities, outputs, and the longer term or the higher level results in terms of impact. When I talk about impact, I mean reduced mortality, reduced malnutrition, reduced morbidity prevalence. I mean, all of those things kind of get
we tend to lose focus on that. Because because of the shorter time duration and also because of the complexities in measuring impact. So that's we need hardcore data to ensure that all the activities are lining up to impact, but it is not necessary that it is getting impact. So that is something that we have to ensure that we are focusing on the higher level research. I'll take an example from what UNFPA is doing along with their network of which is philanthropy arm of the founders of UPA. So we are working with panchayats to ensure social norms are being changed, social norms, gender norms. So we are empowering, capacitating panchayat leaders, so that doing life skills, education, ensuring women's participation in leadership. So there's a lot of good stories, case studies, topics to do that. But does it actually change social norms? Does it change son preference? Does it change gender? What we see as can we accept women in leadership positions at the grassroots? All that cannot be measured. So we are very fortunate that we have such private sector partners who are willing to invest the time and the resources to make these longer term measurements not only demonstrated but also credibly measured. Those are two separate things. So there's we have a lot of challenges in terms of the measurement side. Swapnil talked about attribution. There's a lot of players, and it's very difficult to attribute the change to one particular, to our a particular intervention. So there's and also the actual, and here again we are fortunate to have partners. We are doing another intervention with biopharmaceuticals where we are trying to contribute to their global reach of 100 million additional users of contraception. So we are trying to. So in addition to all the activities which involve very fancy digital intervention, chatbots, but there is also heavy investment to measure those changes and both in terms of resources and the time. What I think, apart from the challenges, I think the way forward is for CSR to also kind of look at invest in the measurements and of these long-term changes, higher level results, and also the resources needed for that, and also sometimes the data culture in organizations also needs some change. It's kind of for many people to talk about all these things is one way of program logic, but do the program implementers, do the implementing NGOs have the data capacity and the frame of mind to be able to look at the data and make meaningful decisions, actionable insights? So those are some of the things where one needs investment in terms of capacity, in terms of data culture, and there's a lot of other innovative methods where one can measure impact also. So those are the concluding thoughts that I have for us to work on moving forward.
Thanks, Mr. Kaushik. So before I move on to Dr. Pradhan, just one follow-up question for you. You referred to change in social norms as one of the objectives of development projects. Do you feel there is enough buy-in for this kind of idea on CSR? Do they really see that as an objective they should pursue? Because the tendency is to look at more tangible outputs, something which can be seen in the next 1 or 2 years, and social norms, as we know, don't really move fast enough. Also, you are a demographer, and you know that population level metrics don't really shift easily. You can't change IMR or NMR in a year or 2 years, but you will get that kind of a request from a CSR, and the development partner has to work towards that. So do you think there is a lack of orientation, there is a lack of awareness on that sort of things among the CSRs?
Yeah, definitely. I mean, there is always a tendency for quicker and more demonstrable results and tangible results, which this earlier panel also talked about. But these hidden norm changes are much more fundamental, and I think a lot of sensitization is required as to how the efforts also line up, at least align to these long-term changes. Because ultimately, it's these norms which underpin all the behaviors and all the health outcomes, and without these more fundamental changes, we'll all, it will be just short-term fixes. So I think a lot of sensitization and orientation is required, and also kind of how these smaller level, the shorter duration ultimately adds up to this. Even when I'm talking about the social norm change, I mean, we just have a 2-year project, but where we are working with Untapped, but ultimately the vision is that kind of you do those longer term social norm changes at a much longer time frame, and there is a kind of explicit understanding that all these activities will lead up to this high level results.
I now move to Dr. Prashant Chauhan. Sorry, I mispronounced your name. You have been observing the CSR space for a very long time as somebody in the academic sphere. What do you think has changed in terms of how social impact is really defined or measured or understood by the CSR?
Yeah, thank you so much, and definitely I'll take also that opportunity to congratulate the sites and Paris for organizing this wonderful discussion and this report. Yeah, I was listening to the earlier session also, and my fellow colleagues have also spoke on that, and definitely CSR is a buzzword we are listening in the past years, and everyone has different interpretation and understanding for that. But definitely the positive side I want to start, because CSR has, somehow I have seen there are certain researches and really on the ground we have seen there are certain positive change we have seen, and efforts are being made, though there are a lot of challenges and issues which the earlier panel also discussed about the area, the community, and the funding objectives and the business perspective, and a lot of things are there. But when we see that the role of CSR in, for example, in the development of a particular area or in the sustainable development or SDG goals that we are aligning with, so definitely there is a contribution is there, and which NITI Aayog's report also has given some information and data on that, and definitely people like DevInsights and many other organizations like somebody here are coming up with the information. And being an academic institution, and because our students, because human resource part, my fellow colleague also, so because this was one major challenge that the people those who are driving the CSR, are they really from that background, or they are qualified enough and they have that understanding that what they have to do and they have that experience. So in that way, things are in a positive note, and things are changing, and somehow changing in the guidelines and the rules of the definitely by the government side also is improving as per their experiences. And if I take some of the examples here, for example, there are some corporates here. I heard that SCL is also there, and So if we take to some organizations are really trying to do in a very good manner on the ground, not just tokenism or some branding kind of thing. And the efforts are also being seen actually. So in health sector also, in water, health, sanitation, wash category also, and many others. So things are moving on, but definitely I was part of one grand jury in the CSR award. So I've seen that people are coming out and there is a rat race to get the awards also somehow, but I'm not saying, but definitely everyone is trying to get some himself or themselves recognize that they are doing something. But we should have that objective. If you are in the social development sector, and being a social work faculty, I believe that by heart and that intention should be there that you want to do something, not exactly by only data or numbers and whether it is impacting on the ground or not. Because we have seen that 2-3 companies are working in a specific community area and somehow they are overlapping also, and at the ground the visibility is not as such as it is seen actually. If you see the numbers of amount or the funding is being spent on that. Recently, I had also one interaction with the government of Uttar Pradesh is stressing the corporates and the other people on, because the Honorable Her Excellency Governor is very interested in the ICDS program because she was in charge in Gujarat at that time. And she is stressing and requesting that the infrastructure and other things should be given by CSR companies to the ICDS. Like for example, in Gautam Mandala, there are 1100 plus Anganwadi games, and the situation of Anganwadi games is very, where a lot of improvement is required actually. So in that, she requested that corporates should come forward and adopt and donate the infrastructure thing. And I've seen, I was in a meeting where Dion and the local administration were bound to, you have to actually, you have no choice. And somehow that meeting was also called in a manner that the directives are there, whether you are interested or not, you have. So I think the way we are handling CSR in our country, some are doing great, as Tatas and some examples were there. And definitely the NGO implementers, the partners, NGOs are doing great work actually. And there is no, we should not criticize that if they are looking out for funding, because if you see the current situation, so major source of funding for the NGOs is only CSR. Actually, if you see the government side, if you see the FCRA, so the kind of rejections of FCRAs are in our country. So I think CSR is boon for NGOs definitely, and both are interrelated. So they should have that gelling and bonding, and they should support each other, I think. And being an academic institution, I want to just say, because I am a social work faculty and representing the association also, that I urge those who are here that if we recruit, if we have some people, those who have understanding of the field work and the community setting and all, so that they can develop good projects and they can demand from CSR also, so that the impact should come at the grassroots level in a right manner, rather making good PPTs and good reports and pictures and on the ground, no effect of that is coming. So in that way, we are stressing, we are training our students, we have introduced CSR in MSW course in Amity University, and we are giving them projects, we have placed with DevInsights also our students to learn monitoring, evaluation and impact, and also that they have a practical understanding. So in that way, we are doing our part, and we are open if anyone found is having anything we can collaborate with in research and all. And DevInsights is with us, so we are also doing together. So I think this way I want to conclude here, because time is also very adverse. The lunch time is here. So thank you. Yeah.
Thanks. Coming to Deepika, the question that we have for you is capturing voices on the ground. Your foundation works extensively with the ground level partners, with implementation partners. What kind of challenges do you see when it comes to collecting evidence from the ground to do you directly do it? Do you have implementing partners? Do they have the capacity to do it? What has been your experience?
Sure. Thank you so much, Mr. Pate. And of course, I'll also begin with congratulating DevInsights and Krish. Thank you so much for bringing us in on such an esteemed panel. The disadvantage of speaking last is that most of the good points have already been spoken. And of course, it's a lunch time, so I understand that. I'll be very brief and quick. Of course, at NASCON Foundation, we work with the partners on ground. And we also have semi-implementation monitoring. We work directly on ground as well in multiple other projects like women entrepreneurship and social innovation. The kind of challenges, of course, before I talk about the challenges that we receive from the partners with respect to collection of evidences from the ground, I'll also say that the kind of challenges that we face from the corporates as well in selling our impact and measurement, the funding that we require for the same. Most of the times we have been questioned that why do you need that when you already have the program team who is there for monitoring and evaluation. Often times, we forget that every vertical which has been created within the organization, whether a small organization or a big organization, we need skilled people. We need people with experience in those verticals. Of course, in God we believe, but everyone else needs been data. And that has been the case with us at Foundation as well, wherein we strive to speak about the work that we do on ground. And most of the times, the implementing partners and the grassroots level NGOs do not have that kind of capacity and the resources and the skill set. And I would definitely agree with Mr. Shekhar and Mr. Chauhan also that, when they have mentioned that we really need some experienced people on the other side in corporates who understand CSR and where the NGOs are coming from. So these are the kind of, quick challenges that we often also face, because in most of the organizations, and let me also tell that we also work with some very good organizations who understand that and do not question, and in fact ask us for those kind of reports and give us that kind of flexibility in terms of multi-year partnerships, which help us to design our programs and actually create an impact on ground. So we are blessed to have been working with such organizations also. And at the same time, we work with certain organizations and often receive requests in just last 4 months and 5 months when some funds are unspent, that by March if you can utilize the 100% funding. Now, though it is at an NGO level, and when you are in a fund development role, we really can't say no to money. We need that money to implement our programs, and of course we want that scale as well. But the war between output, outcome and impact is an ongoing war. And we just want and wish that corporates on the other hand also try and understand that if you are running a program in a community, wherein you're working with the grassroots level people, community members, impact तो बहुत दूर की बात है, output भी 3 महीने में नहीं आएगा. So we just need that kind of understanding from the other hand also. And as I said, sometimes we get it. Sometimes the corporates, they are willing to support us for multi-year programs also, and they understand that yes, if we are reaching out for impact, we need that kind of time. I'll just give you an example with respect to an on-ground challenge, because mobilization of right resources and community members from on-ground is also extremely important. In one of our social innovation programs, wherein we work with mid-age and early-age startups who have already identified a social cause, and they have developed a kind of a device which will help if that particular device is deployed in the local community, in the PHCs, in the local hospitals, government hospitals, that can actually help in early-age screening of cervical cancer in women. Now we are working in Dhule in Maharashtra, and we as an ongoing target, we took up a target of screening 4,000 women for cervical cancer. But when we actually went on ground and understood, the women, more than the women, the family members are not even sending their ladies for the screening, because they're like, if the cancer is detected, what will we do? It is a cultural difference that we are talking about. Is this kind of a program or intervention, can this take place in 4 months? It's not possible. To build
bridge that kind of cultural difference, we need at our level also a skilled team who understands the on-ground challenges, actually work with the local panchayat, district collectors, PHCs and the local government, and understand that what kind of mobilization is required and from which particular village or community or district. And then, when that number of 4,000 is actually there, then, we need that kind of flexibility from the ground as well. So then we were, thankfully we were able to actually convince the corporate, and we actually brought them to the particular district and village and showed them that what are the kind of challenges the women are facing, why are they not coming ahead for screening, right? When they understood the on-ground challenge, they were okay for not reducing the number, but giving us the flexibility to move to work in Pune. So, these are the kind of challenges, and we are able to talk about it and able to convince the corporates about it because we have the skilled team. But does everyone, all the NGOs have that kind of, or implementing partners have those skilled teams? No. When we are appointing a CEO or a senior VP or a director in a corporate, nobody questions their CTCs. But when we are employing good resources as NGOs, we are often asked about, why the resource cost is so high. That is because you need skilled people in NGOs. It is not only a charity work that we are doing any longer. It is, if you're talking about data, if you're talking about impact, if you're talking about evidence, and actually transforming the community, you need skilled people. Just like any other profession, like doctors, engineers, NGOs also need skilled people. So I think it is a need of the hour to invest in the capacity building, as the fellow panelists have also stated, invest in the people for capacity building so that we are able to bridge that kind of gap between the community and the corporate. At NASCOM Foundation, thankfully we are being able to do that, but we do also face our challenges, just like any other NGO that I was facing. Thanks.
Thank you, Nitika. And as you spoke about the need for investing more in the human resources in NGOs, I could see a lot of cases cracking up. So that brings us to the end of the session, but I will just quickly sum up what we have heard from the speakers. Tushar spoke about how some of the existing impressions about CSR sector are not really applicable to where she comes from. Encouragingly, she also spoke about the evolution of the health sector programming at Lupin and how they have moved beyond the traditional thinking and got into programs related to rheumatic health and NCD and respiratory diseases and so on. Swapnil spoke about the evolution that is happening in terms of CSR's approaching measurement agencies for creating their CSR strategies. So there is a tilt towards more strategic thinking that is happening. There is a positive change in terms of better human resources running CSR firms, and that's a very important change. And there is also more appetite for qualitative research and going beyond their numbers. Mr. Kaushik talked about the challenge of attribution of any change that you see in the field and the need to invest more in measurement of change. We heard from Mr. Chauhan about the challenges that NGOs face in terms of limited funding and how the opportunities for them to raise funds are really shrinking every day. And that's what makes the partnerships with CSRs so important for them. And of course, from the Deepika Independent, we heard about the very familiar tendency among CSRs to try and spend their balance towards the end of the year and how that creates issues for the implementing partners and the increasing need for sensitization and education of CSRs towards a greater appetite for data and an overall change of culture. I would end this session there, but not without giving an opportunity to the audience to ask a few questions. I would just take it that how much time do we have for? 10 minutes? Sure. Even if you don't have time, I think I will use my video. Audience must be.
Can I ask?
Yeah, sure.
Okay, I would like
Need
to
a
know.
mic?
No, it's fine. I think we can hear you. Just wanted to know if it was a very interesting, you're from the other side of the table, compared to the previous panel. Thank you very much, and great work each one of you is doing. Just wanted to know if you would have any experience of that, the mandate of impact assessment of projects of certain value has come in. Have you had any experience of doing those kind of commissioning or actually doing those kind of assessments? That's the first question. And second is that we mentioned earlier that we are looking at relevance, whether the projects are actually relevant to the ground. So any experience of having a formative research done before we start even designing a project, if someone can comment on that. It may not be there, but in case it is there, we would like to hear about it.
The first one I want to answer. We had one experience that I'm not criticizing, but when it is a matter of impact assessment, so CSR companies don't take it. Otherwise, they have very selective approach in that. They want to give selected people so that report is being made in a systematic manner, and so that is something which I want to add. Yeah.
I'll just proposition for the first one. Most of the corporates, when they are spending more than $1 crore, a third-party impact evaluation is a mandate. And of course, yes, we also face that. And any CSR funding which is more than $1 crore, we do get requests. The only challenge is that happens after 3 years. Almost 2 to 3 years.
After the project has
After
ended.
the project has ended, the community members or the beneficiaries have moved on.
So the recall value
Yes.
is less.
So then you have to start the journey all over again, going back to that particular community, and we have seen that happening, and that's very unfortunate because we have one project in terms of skilling and employability, wherein we are skilling the youth in emerging IT technologies. Now we are working with the youth in the college domain mostly, and when they pass out, after a year, even after 6 months only, after a year, they don't remember. And we have to start that journey again to create that recall value time and again. And when you're dealing with youth, they change their mobile numbers so often, so it becomes so difficult to actually participate in those impact evaluations. But yes, that is, I think, it is a mandate, and if something can be done, if it is possible to be done within the year of implementation, I think it is
Even
still,
that is part of the mandate.
yeah, it is
The
a part,
timeline
but
is
it doesn't,
also.
but it doesn't happen that way. It mostly happens only when the audits or something are happening, and then they come back and ask for impact evaluation. So that becomes a challenge as well. The second question, if any.
Yeah, I would like to respond to that. And I was just mentioning it in our in the panel, the first part of the discussion only. We have done a research to initiate this program both in Alwar and Palghar districts with DevInsights, and I think that has given us a lot of ground for the kind of strategy that we have created, and we are very happy to implement. And then you definitely be doing an midline and endline to understand how this goes. Thank you.
As every agency, there is a balance between loss and content we need to be cautious about. Intentionally, we have not taken up work which are pure loss, and that you would see in our business file as well. But there are temptations, but there are specialist agencies who deal with loss only. So rather step back and not do the loss. But I also seen that loss can be easily sort of coupled with content, and that's why we have started picking up some work. And it's also driven by the way philanthropies think about evaluation report. And I see CSR also learning from the basic philanthropic organizations have been historically dealing with impact reports. On the second part, I sort of borrow sort of a quite misused term internationally, which is impact management. So impact management has been something that India has not talked much about. But when we advocate as impact professionals, we all advocate for a full 360-degree impact management. So impact management begins with the situational analysis. So why do you choose a particular geography should be scientifically driven. So like the DevInsights is doing for you. So it has to be scientifically driven. It cannot be safe. We see clustering around Maharashtra. It is not scientific. Yeah. So it is much more opportunistic.
Yes.
So at a meta, not saying at a specific. But there are instruments like say organizations like DevInsights what we are doing. So we recently launched a platform called Development Intelligence Unit along with the Transform Rural India. So one of the features of it is that it's a kind of a massive portal of public data. So we have a specialist feature for CSRs to deploy we have around 69 data sources there and an intuitive dashboard.
Can you repeat the name?
Development Intelligence Unit. So what we have fashioned as the term is rural quality life experience. So if a CSR has to sort of choose a geography, so it can go to the dashboard and see, it can relatively sort of measure the privity of that district or that panchayat or that political constituency. We have electoral constituency as well as administrative constituency. So one can rank, one can adjust, one can sort of look at combinations and permutation and combination, and then invest in a particular geography. It comes from that space only. So people are getting conscious, like you have gotten conscious about being more scientific about it. But beyond that also I see hand-holding has to happen throughout the project cycle.
You have to create a demand for it. Yeah. Thank you.
Swapnil, this is a follow-on to what you just told about your dashboard. Would your dashboard be able to then conclude from the number of hits that you're getting on the dashboard of how many of them, even before how many, would it actually tell somebody that, in this particular block, district or ward, there is a crisis with governance, public financing, blah blah blah. So all the pillars or systems that I'm talking about, and you can potentially invest on that. So beyond the geography, can it go further to that? That's the first question. And till now, I don't know how long this has been existing, but till now, how many hits have you received on this, both on geographies vis-a-vis this demystification of the pillars are there?
So this dashboard was created for Ministry of Rural Development, and because of some institutional change, we could not actually deploy. So it's now an open resource. I can share that link with you all. So we have opened it because now it's beyond MORD, so it's open for usage. In fact, yesterday we were looking at options of monetizing it, and we're keeping some portions of it behind the paywall. But the idea here is that what you rightly pointed out, we have to monitor footfalls on the website and then then get into the monetization part of it. But for CSRs, we have to customize it for the CSR to get extracted. For now, it's for public use and anyone, any academic, because we have the primary data source for that is Mission Untitled, because that's the only live data that we have currently. We don't have census, we don't have more or less most of the national surveys are not that important. So we have Mission Untitled, we have other public sources holding data. So we are looking into customizing it and tailoring it for CSR purposes, and that should be part of it to be monetized and part of it would be more open data source. So we got some funding for it, we stabilized it, now we are getting to it was launched last year only, but because we could not make it public because it was housed within
I just want to understand that, the
major CSR spending is in those 5 states. What is the reason? Is it because they started much earlier, or is it there are some challenges in investing in, say, northeast states, that the companies are not going to those areas, or say, what stops looking, for example, I'm just saying, for not entering into Bihar? And Bihar is the one state where you find that the spending is the least.
Totally agree, ma'am. For Lupin, the problem is slightly different from the other corporates because Lupin believes in the philosophy of implementing all these programs itself. We have like 400 staff members in Lupin Foundation, and therefore geography becomes a constraint for us because we have a certain setup until now, and to go into a completely different geography, which means establishment. And though personally I am a believer of being able to do more efficient work in partnership with the NGOs, but our board, our top management has a very strong belief in doing it in-house, and has been doing it for 35 years. So there's such a strong inherent belief that that is the best way to do it, that I guess changing that would take a significant amount of time, which probably I have not spent there. I have been in this job for 3.5 years, but that's the primary reason. Otherwise, we have such issues of sticking to a particular geography. We do not work in our factory locations alone. We work in very different districts. We work in Vidisha district. We have absolutely no presence in Vidisha. So, for example, but Northeast is really our entire setup. We have, of course, we have some intervention in Sikkim, which is where one of our factory locations is. It's not a very big intervention, but we do have it.
Hi, just one last question.
Okay.
So, hi, I'm Charlie. I work at Project Concern International. And first of all, thank you to all the panelists for such an enriching discussion. My question is for Swapnil. As you rightly mentioned, pursuing CSR and having a strong M&E component in their project, it is a real life challenge because I work in an NGO, we work with CSR, we make project designs for them. And at the project design, ideation level itself, it's a very big challenge because see, the funds are limited and always the program implementation has an upper hand and M&E sometimes take a backseat. But as some other panelists also mentioned that sometimes we propose an innovative concept to be applied, for example, SCDs or norm shifting intervention, which will require scientific M&E to capture those impacts. So my question is, how do you persuade CSRs to include strong M&E, strong critical change, and those kind of frameworks at the project design level itself?
So, short answer is we have not been able to persuade. But having said that, there are brighter spots as well. So, one of the classic problems with family agencies like somebody is that we tend to become quite curious and arrogant about what we do. So I've seen, and this is something that internally as well, we sort of talk to our colleagues saying that we cannot be arrogant. We don't know more than implementation teams. They are much more accountable for implementation that is happening than you as an implementation. You will always remain in the agency, they are external forces. So this arrogance also belittles the value that we give in innovating on approaches. So with private sector, including CSR, I've observed that if you create value for them, even if compliance is definitely a priority, but if you create value for them, even simple participatory approaches can add value. You don't even have to talk about exceeding. Simple Robert Chambers का जो अपने PRA पढ़ा था वो भी काफी useful. So the fact is that we don't get down to that level. So I have seen my folks writing technical proposals to CSR agency, applying all sorts of statistical tools into it, which I am sure that 9 out of 10 CSR would not appreciate. They would not understand what is PSL to start with. For a 30 lakh evaluation, they would not appreciate. So what can you do? What else can you do? So it is also us as responsible for creating an ecosystem where we thrive on innovative approaches. We may choose not to measure social norms through difficult evaluations that people do. We are not academicians, we are practitioners, we are here to create value for implementation.
Maybe one of the innovations can be to use lean samples.
Lean methods can be.
I think I'm afraid I will have to end it there. Thank you very much to the panel for a very, very informative presentation.
I would like to thank our panelists for the engaging discussion. Can we take a moment to take a picture with the report? So could you also come on the stage? But sir, could you always also come on the stage? Now I would like to call Ms. Nayak to present the esteemed guest with a token of appreciation.
सेक्शन है ना फास्ट वर्क करती उसमें तीसरा क्वेश्चन है
Once again, thank you so much to our panelists. As we come to close of today's event, I would like to invite Ms. Anju Malhotra to deliver the vote of thanks. Please welcome.
Am I audible? Yeah, I think so. So, I'm filled with immense gratitude and pride for the incredible insights shared and the enthusiasm demonstrated throughout today's event. On behalf of DevInsights team, it is my honor to deliver the vote of thanks for this remarkable occasion. First and foremost, a heartfelt thank you to our distinguished guest, Mr. Harsh Mangla, for gracing us with his presence and sharing his invaluable thoughts on the transformative power of CSR in healthcare. His vision and leadership continue to inspire all of us. A special thanks to the honorable panelists for their expert contributions to the discussions. Professor Aksa Sheikh, Mr. Neeraj Jain, Ms. Tushara Shankar, Dr. Nitya Arora, Dr. Anuradha Jain, Professor Prashant Chauhan, Mr. Kaushik, and Mr. Swapnil Shekhar, and Ms. Ritika Arora. Your collective wisdom has provided us with deep insights into the opportunities and challenges in CSR for healthcare. A big thanks to all the panelists for acknowledging the need of impact evaluation research firms like DevInsights. I would also like to thank our moderators and very experienced personnel, Dr. Bulbul Sood and Mr. Prasanna Khate, for leading the conversations with such grace and expertise. Your experience and dedication to public health have added tremendous value to today's event. Our sincere gratitude extends to all the participants who engaged with thoughtful questions, enriching today's dialogue. It is your curiosity and passion that keeps the spirit of CSR alive and growing. Lastly, a big thank you to the organizing team of DevInsights behind the scene who have been our foot soldiers in making this event so, organizing it so well. Your efforts ensure that today's event ran smoothly from planning to execution. I don't have words to compliment you further. I thank everyone for taking out the time to be part of this important conversation. Let us continue to strive for a healthier, more equitable India through our collective efforts. With this, I wish you a pleasant afternoon, and I request everyone to join us for lunch outside. Thank you.
ये बंद कर दो.
Thank you.
Are you sure?